another 1.2 million. So basically our EMS fees bringing in that help support our budget is about $3 million. We believe that we're still in that range this year. They did some calculations are a little different when we did the supplemental, and we're working through that with the state, with MIMS and our other partners to make sure we get as much back as possible. Just a little bit about the building inspections. That's the numbers we did. We had over 1,100 permit and plans reviews last year, and the Fire Marshal's Office collected over $95,000 in fees for the services they've provided out there with the inspection fees of the technical inspections. And just a little bit about our programs that are out there. We trained over 500 members of the public in CPR, hands-only CPR and Narcan administration, and we actually distributed over 250 Narcan kits. So they were the highlights of the current budget. So we just wanted to make sure that you were aware of that, and we continue with our core strategies and our performance objectives, and we are meeting those. So this year, it's the same. Firefighter safety is our top priority. Fiscal responsibility, the training and education of our people is of utmost importance to us so that we can provide the best quality service out there. We talked with the physical fitness equipment about the wellness and the fitness of our people because we have to be healthy and we have to keep them healthy so that we can provide the service. We're proud of our diverse workforce and the outstanding services that we provide. So with this, it goes into our performance measures. This is broken down into the goals, the benchmarks, and the performance measures. So the first one is always, as you know, as I took over as chief, it's always my number one priority is firefighter safety. So our objectives out there to reduce the injuries of our people. We do that through tracking of our injuries, the cancer awareness programs out there. And our performance measures is the number of workers' comp claims, the number of vehicle accidents we're involved in, and the training hours. The second one is for us to provide a safe environment to the community. As you see, all of our performance standards go along with our mission statement. And this is just how quick we get to calls, how the number of personnel we have on the scene, maintaining our ISO standards and meeting those national standards that are out there. The third goal is to continually staff the operations section of the department and have the proper number of paramedics and advanced life support medical providers out there. That is difficult throughout the United States right now. It's difficult for us to get paramedics. We are competing with every jurisdiction out there. They're doing signing bonuses. They are doing all kinds of alternatives to try to get medics in here. So we continue to do that. We have a goal of having 12 ALS providers per shift. As you know, we run 4 shifts and then a day shift. Fortunately for us, we've had a lot of medics that get promoted, so that helps us. But that takes them off of medic units, and we're not heading in the direction we would like to have the number of ALS providers per shift, but we're tracking that through our soft openings and our daily operations. The outreach programs that are out there, you all are well familiar with it. You see our people out there all the time. Probably the biggest now, while we do the friendly firefighter and the stuff for the younger kids with fire safety, but our biggest program that's out there is Your Life Matters, and that has to do with that hands-only CPR and the Narcan administration to help support our opioid crisis that's there. This is a goal that we have. It's sort of more of a long-term goal. We try to do alternatives because of our hospital wait times, so we're looking at different ways to try to reduce that. We work very well with the hospitals. We've implemented some programs out there that the other jurisdictions in the state are looking at when it comes to us offloading patients at the hospital. We meet with the hospital on a monthly basis. We have an alternative destination policy where we try to take people to a primary care facility. It's MedStar out there across from the mall. We have a program with them, but we find a lot of people don't like that, and there's some criteria that comes along with the alternative destinations, like they have to have a ride home, and it's a strict criteria of who we can take to those facilities. So we're attempting to do that. We're attempting to do the telehealth. It has not taken off and it's not been very successful for us. And it's hard to do. And with the telehealth program, we have to have a medical facility like MedStar, but they have to have a 24-hour person available to do telehealth. And it's sometimes hard to find because they close at like 9 o'clock at night. But we continue to work upon that. So some of our long-term goals are out there. While we have our ISO Class 1 certification, we still want to go back and do the Commission of Fire Accreditation. but it's a long-term goal for us. It'll take us some more to get that through. The mental health and suicide prevention for our responders. Mental health has become an issue for first responders throughout the United States, not only with substance abuse issues, but taking their own lives. And we are constantly looking at ways to make sure that our people are getting the resources they need, because bottom line is we send our people out here every day to see things that nobody should have to see, and they deal with it on a regular basis. So we need to make sure that their mental health is done, and that's high on our priority list. And then the other one's the continual upgrades to the 3 aging fire stations here in the city of Annapolis. So just a little bit about the updates, because we know the performance measures are there. This is where we are. This is what's been very successful for us in those performance measures, and that's our overall response time. So once our units get on the street in the city, this is within the city limits, typically once they go responding, they're there within 2 minutes and 45 seconds. It takes them about 1.5 minutes to get out of the building. So we are meeting that 4-minute national standard of getting people on scene within 4 minutes, 1 unit on scene within 4 minutes. The national standard to have an ALS provider, which is a paramedic on scene, is 8 minutes. We average 4 minutes and 11 seconds. So we're very proud of that. And that's what helps us maintain the services that we have. In the initial alarm assignment out there, that's having a minimum of at least 15 people on scene of a structure fire. The national standard's 8 minutes. We're there in about 6 minutes and 15 seconds. So we're maintaining that minimum staffing of 25 every day. That's what we need. We have 4 shifts. We have 30 people assigned to those shifts. You take 4 people off on annual leave every day. That takes you down to 26. That leaves you 1 person for sick leave training before we have to start paying overtime. And while we'd like to maintain that 30 with our soft openings, meaning people that are injured, pregnant, FMLA, it's hard to keep that up there with just the 30 people, but that's where we are. We're running into just some issues with that mobile integrated health, and that's going to be a long-term goal that we still want to work for in the city, and then to decrease hospital wait times. As I told you just a couple minutes ago, what's not working for us is maintaining that ALS rotation for our medics, because we don't have enough medics out on the street, and then hiring the ALS providers. Here's what you want to see, the difference between the current budget and next year's budget. And as we go through it, while there is an increase, most of that increase is around our personnel costs. And a couple slides later, I'll show you just a couple of items that have highlighted that. But those costs are the union negotiated pay increases that are there. That's our health care, and overtime is all built into those aspects. Contract services is going up a little bit, and I'll explain that as we go farther into it. And then you can see where the supplies and the capital outlay, where's the difference. You'll see a decrease from last year because we're on some of those items because of the one-time expenses for the alerting system, the monitor, and the turnout gear that you all provided for us. So there is a slight decrease for those. I know that one's a little blurry. You can see it a little better on your slides there. This is it. I tell you all the time that, yes, I realize the fire department has one of the biggest budgets in the city. I explained to you just a minute ago about the number of people we have to have working every day. And this pie chart says it all. 93% of our budget, it is our budget, is salaries and benefits for our people. That's just for us to maintain those people, the firefighters and medics, to be out here on the street every day. So when you take that out of it, you look at contract services as the next big part of it. It's 1.3 million. You got to take 700 and some thousand off of that right off the bat, because that goes to fleet services, so that fleet services can keep our equipment on the street every day, and that's our portion of how they fund the fleet services accounts. So then you get into our supplies, which is a very minor part, in our capital outlay. But this chart says it all. When we talk about trying to make cuts in the fire service, I continue to stand behind what I've told you in the past. The only way for us to make cuts is with our staffing levels. And if we go by the national standards, we're not where we should be on the number of people on our apparatus. So I just like to show you that and point that out there, because it hasn't changed over the years and we're still there. So here's a little better chart, just so you can see the comparison, what's in the proposed budget. There are the increases there, and the salary increases. There's one position in there that's part of that salary increase. So over the last 2 years, we've been taking a very hard look at how we're providing medical care to the people we serve. What makes us so good is that we have so many people within our department that wear multiple hats. Sometimes we overload the positions that we have. EMS is the medical part of what we do is 73% of all calls. We had one captain that was running that division, and it was just overwhelming. And we've had to take a serious look and do some revamping over the last 2 years about how we're doing it. And what we added some additional staff supervisors positions to EMS so that we could be where we should be for especially a part of our department that's handling 73% of what we do. So we upgraded a lieutenant's position to captain within this current budget, and we also had to make an EMS training officer position, which was a captain's position. So portion of the increase here is for that one position. But by doing that, as I explained, we needed 30 people on each shift. We took one person off that shift. So one shift is down to 29 right off the bat. So this allows us to put that firefighter's position back in there. The captains are already at that rank, so their salaries and all would have to be funded either way at that, but we are asking to fill the firefighter part of that position. So you will see one increased position within our budget. Our overtime costs continue to be basically what they are. Last year, we were looking to try to do it we figured it would be around 850, 900,000. But since COVID kicked in the pandemic, it's not like we've been able to do in the past. We have very dedicated personnel that work for us. They would come to work not feeling well. And we could watch somebody come in with coughs and sniffles, and then by the end of the next week, the entire crew from that station would have those. So we don't want people coming in sick, which with the pandemic, you also know that we've had COVID, we've had other issues, and the sick leave goes up. Sick leave is one of the largest costs of our overtime budget, but we don't want our people to be here working sick. And they did. They would come in here before and not be feeling 100%, and we typically will send them home now because we don't want it to work through and we want everybody to be healthy. So our overtime costs are up there, and part of that is maintaining that staff at 25 every day. As I explained with the number of people on shift, we have injuries, illnesses, and pregnancies, which take somebody out of commission for almost a year from time it goes through the process. So we've also found that with FMLA, our male parents now are taking the quality time they need for the bonding. So where years ago you would see somebody come back in a couple shifts, they're taking that, and we actually endorse that. We want our personnel to spend time with their families and make sure their families are healthy so that they're healthy when they come to work. So that is a increase for us as our overtime budget, but we're projected to be right around what's in the proposed budget this year, and we feel that that's more accurate representation of where we need to be with the overtime budget. Employee physicals, there's no change in that. All of our firefighters get physicals every year. And as you know, with the police reform bill that came in last year, we have to do mental health evaluations for our law enforcement officers that are part of our department. So that's all included in those costs. The other ones are very minor increases, and it's basically inflation. Everything has gone up. As you know, you got to buy groceries, you buy fuel, everything's gone up. It's the same with us. We are still seeing a problem with getting equipment and parts because of the backlog and getting things, and it's just the cost of doing business is extremely high these days. You have the contract services. You'll see in our highlights that part of it, as you are aware, we work under a medical director's license. We probably are getting the best bang for the buck of anybody around us. Most of the jurisdictions around us are paying six-digit salaries, in the high six digits for their medical directors. Ours is a part-time medical director who, in this current budget, we've budgeted for $50,000 stipend for that person. So we get a lot out of our person. We can't ask for more than what we got. We are still doing very well with that. So that's part of the contract services increase. Also, we had to replace our system for our reporting system, our RMS system. We changed it last year. We went with a vendor who was relatively cheap in price. It was meeting our needs. We got them in here, and this year they turned around and they tripled the price on us. So we had to take a hard look at our reporting system. Anne Arundel County was switching theirs at the present time too, so we were both going with the same company for the reporting system because it's so integrated. So those costs are in there, but it's a yearly cost, so that's there. One of the biggest highlights we asked for as we were really looking at revamping how we're providing our services, for our medical services, and for our firefighters. We want to be able to train our firefighters and medics properly. They need to be able to interact with other jurisdictions. There's several conferences that we'd like to send some people to that we haven't been able to just because of the way our budget was in the past, and to actually do some more of our medical training. So that's why you're going to see a pretty good increase in the proposed budget for the training and education. But that's dwindled down over the years. It really has, because when we were looking to do budget cuts, that's one of the areas. And we got to the point where it's not a large amount, and we're basically getting back to where we need to be with that. Dues and memberships, it's like anything else. It goes up a little bit, but this is for International Association of Fire Chiefs, the arson investigators, the National Fire Protection Association, which you have to be a member of because they do the standards for all fire codes and that type of stuff. And then the capital outlay, there's a big decrease in that because of the services you provided us last year that we won't need this year. So here's the highlights that I basically discussed. Additional $30,000 for the medical director. The decrease because of, I've covered most of that. Let's see. I think we covered it all. But we'll wait for questions after that. So that's where we are. So I told you I'd get through our presentation so we can make to the important parts of the discussions that you want to hear.
Thank you. And thank you, Chief. First of all, let me say, don't ever apologize because you take up a large percentage of our budget, because it has been said by the community time and time again, they value what you do. I always say we're a service organization. You know, it's not about a widget that we're creating. We're providing a service to the community, and your department is one of the most vital in the city. So please don't ever apologize because of the percentage of the budget that the fire department takes, because it is needed, it is deserved, and it is valued. Okay, so I have a lot of questions. Some things just to clarify, because I'm not sure I heard some of the items, and so I'm going to be all over the map because it's not organized.
That's fine.
First of all, Narcan. I saw on the news that Narcan is not going to be free anymore. Are we having to pay for Narcan, or is there a change in the distribution of Narcan?
So Narcan is going to be able to be bought over the counter, which will probably increase the amount of Narcan on the street. It will increase that. Currently, we have 2 programs out there where we get the Narcan, and are we paying for Narcan currently?
No, sir.
Currently, we are not paying for Narcan, so.
Mm-hmm. Yeah. So will we have to pay for it, or will we still get it free, or?
Currently, we don't see a change in the way we do our Narcan program. Now, then some of the Narcan we give out for Your Life Matters comes through Office of Emergency Management, where they have the OD-free, our program, and one other program, and that comes out of their budget. Then they provide that to us so that we can provide the overtime and whatever other supplies we need. But that is not in our current budget.
Okay, so that will be a question for OEM too, to see if they expect to continue to get it.
Yes, ma'am.
Have access to it. Hiring. You mentioned, 30 on a shift. Sometimes it's 25. There's sicknesses and unexpected, things, and pregnancies or whatever. Would it benefit to hire more? And would that also reduce your overtime?
So the fire chief would not sit up here and tell you it would not benefit from hiring more. But for us, hiring more would be more geared towards putting the 4 people in the suppression pieces that meet the national standard. So every person we hire would help, essentially would help the overtime budget. However, increasing the overtime budget just to pay for the slots, I believe, is a cheaper aspect for the city because we're already paying the health care for the employees and that stuff. And when we go to hire new employees, those additional costs are put on there. So right now, for us, while we would like to see more people within the department, the highlight for us currently would be is getting the overtime budget to where we think it needs to be. So we're not juggling money around at the end of the year to try to make sure we stay within budget and don't have to come back to you asking for more money.
Thank you, Chief. Hospital wait time. You know, the medical center is now under Luminous. You said you have ongoing discussions with them. Has it improved our wait time, and are there other options other than leaving our staff in the ambulance there until all of the stuff is done?
So we have worked with the hospital. We've implemented a new policy for our providers that after 20 minutes, the hospital basically has to ask us to stay with the patient. They have to get permission for that. After another 20 minutes, and maybe 15, I might be misspoken here, but within that time period, because we've gone back and forth on the times, then they have to call for an EMS supervisor to be involved. Our hospital wait times have decreased. They have gone down. But I don't know if you've seen on the news over the last month or so, Maryland was one of the worst hospital wait times in the United States. And I don't know the reason for it. The healthcare in general is tough. It's tough. We continually to look at these alternative ways. It's just we have not found a good alternative to be able to decrease that. But our hospital wait times are getting better. We work with them on a regular basis. We meet monthly, but our supervisors are out there every day. And when the hospitals go on reroute or our units have been there for an extended period of time, our supervisor goes out there and they try to help clear it. So we continue to work with them. It has gotten better. It still needs improvement, and we'll continue to work that way. But this is ongoing throughout the state. It's not just us.
So if the supervisor goes out, does that free up the EMT staff to take the ambulance and go elsewhere?
Not necessarily, because the patient is on the stretcher, and there's not extra
Okay.
stretchers at the hospital to throw into the unit. But the supervisor helps facilitate with their charge nurse and the people there to really work on it. See, for us, we're not like Anne Arundel County. We don't have 30 medical units to pick up the calls. When our 4 units, and then our peak time unit, which the crew from the Eastport Station gets off that ladder truck, takes that medic unit on calls in the city when it's needed. We don't have that resources. And sure, we're going to get it. You call for an ambulance, you're going to get an ambulance. It's just a matter of where it's coming from, because it could be coming from Early Heights, Glen Burnie, Wall Chapel when we get to that point, and we try to not do that. So when we have our 4 units are stuck at the hospitals, we go out there and we make sure that, and the hospital realizes now, because they just figured we're part of everything else, and somebody else will pick up the call, and we've educated the hospital, and they understand it a lot better now too. So we're working it.
You mentioned, I don't know whether you used the term hospitals closing, but when our hospital closes and you've got to route a patient to another hospital, how frequently has that improved?
So the hospitals go on reroute. We generally are the ones that they're not closed. It's reroute.
Yeah.
Our medics are the ones that place them on reroute. When they have so many units at the hospital and nobody's moving, our medics will put them on reroute. The hospital can ask for it also. But typically when they're put on reroute, it's because our medics say, there's too many people here. We have to look at going somewhere else. 90% of all people we transport to the hospital go to Anne Arundel. And then Baltimore, Washington is our second facility. We will take them over on the Eastern Shore to the urgent care facility there, which is an emergency room. It's not like the urgent care out here at MedStar. It's actually an emergency room. But those patients, and we'll go to Bowie Health. So it happens daily. We're always watching the charts on the computers to see what hospitals are available. And sometimes it's better for us to take somebody to Bowie. They can take them to Bowie, unload their patient, and get back here before we're still stuck here. So,
And then they're on their own for figuring out how to get back from
they
wherever
are on
they
their own.
end up.
That's, yeah, sometimes the residents get upset about that. And that's part of the thing about going to the alternative care for MedStar. And that would be like if they need a suture or they just need an evaluation, we send them out here to MedStar, which is the old Right Time Medical across from the mall. But the criteria says they have to have a ride home. If they don't have a ride home, we can't take them there. And sometimes people just don't want to go to that facility. They still want to go to the hospitals, even though we talk to them. But we're going to take them where they need to be.
Yeah.
We'll get them there.
Medical services, mental health services for our employees. I mean, you mentioned the fact that you guys see things pretty horrific things. Is there or should there be mandatory psychological review after specific incidents?
So when we have a traumatic incident, we have a peer support team within our organization, and we have contracted with a mental health doctor that's on staff for us. It's a contract position. They work hand in hand together. We do some peer support during that, after those incidents, and then they check on the providers after. So we have a program that's in place there. We also have the city EAP program that's not taken advantage of as much as it probably could be. For us also, which is good for us, in Prince George's County, the International Association of Firefighters have the natural facility there for mental health that our people have taken advantage of. So we are committed to it, the mental health of our providers. We have some resources out there, and we're going to continue to look at what's needed. But after a serious incident, we actually have at least peer support and try to get our people to talk.
Well, good. I heard you mention sick leave. Should that be an item that's on the table to increase sick leave during negotiations? We're in negotiations now for next year. Is it next year, Mr. Malinois, for 25? So should that be an item should there be an increase in sick leave? And I'll preface this by saying I'm not as familiar. I'm used to sick leave and personal business. I think you get sick leave and annual leave.
They do. They get sick leave and annual leave. They earn so much depending on their years of service. The firefighters actually earn more, and the union president's back here cringing because I'm getting ready to say this, but they earn more annual leave than other city employees. I believe it's an additional 4 days or something.
Well, they max at 36 and we max at 21.
Yeah, so I mean, they do get additional there. We only have a few providers that run into issues with their sick leave, and they are the providers that typically use the majority of their sick leave, whatever leave they have. I would leave that up to the negotiation process to see if the firefighters union that's something they're looking for. But currently, we don't have a major issue with people not having the sick leave and being able to take that sick leave. So.
Well, I asked because we should be helping the management team determine what's on the table from management perspective. So we should know that little bit of information.
No, I appreciate the question.
You mentioned the equipment that we funded last year, the PPE.
The personal protective equipment, which is their structural firefighting gear, yes.
Yeah, was that the equipment we were going to replace because of the chemicals?
Mm-hmm. Yes.
So that has all been taken care of, or we're still gradually?
We are. The purchase order has been cut for everybody to have the set of turnout gear. It's just a matter of getting the turnout gear in here. It's all on order. It's been ordered. The money's set aside for it. So it's just coming in lots, certain lots at a time.
Okay, I think my last comment is, and I use my little trusty calculator on my phone, And I divided, according to your slide, the number of days in the year to the number of calls. So by my calculations, you make 35.3 calls a day.
Emergency calls, yes. Yep.
That's phenomenal. So congratulations.
And that doesn't include them going out and doing the training they need to do every day, the inspections. That's the emergency calls that they're responding to. So we appreciate you recognizing that.
Well, give us the right numbers, because it's better than what I came up with. But
No, you're close. Most of the stations are running 10 to 15 calls, depending. The Forest Drive station is probably the busiest. The Eastport Station, Taylor Avenue, they have more people in the stations because of the apparatus that are in those stations, but they're all steady. And people tell us all the day, for the city of Annapolis, we hear sirens all the time. We see them on the street, and yeah, they're busy. They stay constant.
and the Annapolis Next Station,
Yes.
we're there.
So we share that station.
Yeah.
We have a medical unit there and an EMS supervisor, and the county owns the station. We reside in the station with them every single day. And more than 50% of the calls that the county unit runs out of that station are actually in the city of Annapolis. So, yep, it's a good partnership.
Oh, good. Thank you. And Jeannie, I'm disappointed because there was no pictures. She knows what I'm talking about. Thank you very much. I think that ends my question.
Thank you so
Madam Chair.
much. Alderwoman O'Neill?
I actually don't have any additional questions. I had written down several of the questions
Yeah.
that
Yeah.
Alderwoman Finlayson had, but thank you very much. I appreciate the format of your report and the details.
Okay, I'll go next. Yes, I thank you, and yes, most of my questions were answered by Alderwoman Finlayson's questions, and I really, I can't understate this, and I hope other departments follow your model. I was looking at your, goals from last year versus this year, and thank you so much for aligning your budget so well with last year. That's so we were able to, measure the progress. So with that being said, if I understand correctly, you have three maintaining long-term goals: the medical, the mobile integrative health is one that you're struggling with, and mental health, suicide prevention. Is that, do you still consider that a long-term goal?
We still consider that a long-term
Yeah.
goal, yes.
And the accreditation.
Yep.
But you did do the upgrades to the 3 fire stations, if I'm not.
The upgrades to the fire stations are ongoing, and
Okay.
we continue to ask your support when it comes to Public Works budget. I'm not sure what's funded and not funded at this point, but the upgrades to the station are ongoing. Our stations are aging. Eastport Stations was built in 1960-something, 3, I believe.
So we'll
That
hear-
station at one time was going to be torn down, a new station was going to be built, and that was on the city's capital improvement budget, and somewhere along the line, it went away totally after, the market crashed and budgets crashed. So we've been constantly upgrading that station. We were able to upgrade the female facilities in that station, which has helped us tremendously. However, it's still not good because the females have to walk through the engine bay to use the restroom to go up to the front of the hall. But the men's facility in that building, the pipes are coming up through the floor where the toilets and the sinks and all are. So the city actually had a architect in there to look at redesigning the restrooms. The intent is to put in individual restrooms, unisex restrooms with a bathroom facility and a shower so that they can go in there, and so that the females don't have to walk up to the front of the building to use the facilities. There's 2 officers' quarters up there. We would just convert that to the officers' restrooms in that facility. But the other facilities are not much better. Taylor Avenue is the newest, and even when we built that facility, I think we put 1 stall in there and 1 shower for females. We have over close to 25 females in the department, and when you have multiple females in there trying to share the facilities, and the Forest Drive female facilities are terrible, and that is also being worked on currently through Public Works to upgrade those, and the goal is to have individual restroom facilities in there so that it's better for the personnel working there.
Okay.
Because it's their home. It's every 4th day. That's where they live. And
Well, I made a note to revisit that in the capital improvements budget.
Yeah.
last year we added a QA officer. I'm not sure if you spoke to that.
So the QA officer was added. That was part of the revamp. That was a lieutenant's position. That person is a day work position that we're able to do QA all of our reports. So we do quality insurance on all of our EMS reports to see if there's any trends out there, to see if there's any protocol variations that need to be addressed. So that position's in there. And as I was talking earlier, the captain not only was in charge of the QA process, they were in charge of EMS training and several other administrative functions, and it was just too much for that person. And that's why in this budget you see the upgrades for that EMS training position.
So there was value added.
The absolute value was added to that, and the EMS training position is just going to move us leaps and bounds to where we need to be with our EMS training.
And two quick questions as far as money coming in. Fire marshal fees collected, the $95,000, is that on permit?
They're all permitted fees, yes, ma'am.
Wow.
Yes.
How does that compare to years before? Just seems,
I would have
Because
to
you-
research that one for you.
I bet it's better because you added the fire engineer. to
Yes, the
expedite
fire
review.
protection engineer that we've added over the last several years has helped us tremendously
Expedite them, yeah.
within the
Yeah.
permit process. I
Putting
think
words in your mouth.
you still, you still hear from contractors that the city's hard to deal with. I'm just going to tell you because we still hear that. And I can tell you that no matter whether it's the electrical inspector, the plumbing inspector, or the housing inspector, if there's a violation notice, the fire marshal's the one that issued that citation because that's what we hear all the time too.
Yeah.
But yes, it has, but those are all permit-based inspections that those
Yeah.
other inspectors would be involved in too. So they're bringing in permit inspections for those also. This is just the fire permits.
We're still hoping that that $20,000 we put in a couple of years ago is going to be utilized to look into our permitting process. My last question is, I think you spoke to it, the EMS fees went down substantially. I believe it was $3 million in EMS revenue last year. Now it's about 1.8.
So that's what I was
And that's
explaining in there.
about
We don't have the supplement yet.
Right.
We've asked for that supplement.
Yep.
So the 1.8 is the normal EMS billing. We can now, at the end of the budget year, go through a process that, and I'm glad you brought that up because I have something else to bring up about that. We go through a process with Medicare where we submit the actual cost. This year, they decided that they were changing the way they looked at that, and where we were anticipating the 1.3 additional, they came back and said it was going to be like 800,000 or something. But it's not necessarily an appeal. We've been working through that because the other jurisdictions around us have had the same issue, and we just don't know what that amount is yet. But we plan on that being close to the total amount is close to about $3 million still. It's just not in our presentation because we didn't know where that was going to be, and we're in that part of the process now. But we still think we're going to maintain about $3 million for EMS billing.
Oh, okay. Very glad.
What I didn't bring up as part of the capital outlay, and I'm glad you reminded me because Jeannie didn't. She was going to kick me here in a minute before we ended. So with the medical billing, there's a requirement under Medicare or Medicaid? Medicare, probably. Medicaid? So every EMS jurisdiction in the United States has to go through an audit because we bill for Medicare and Medicaid.
But it's for the Medicare bill.
It's for Medicare billing. And Annapolis, being Annapolis, in the A's, we are one of the first jurisdictions that have to do it. So there is a it's about $35,000 audit for the most part of our EMS billing that's got to be done. And it's done through a third party and provided to them. If we didn't do the audit, they would take 125 to 150,000 right out of the EMS billing. So if we didn't do the audit, we're going to lose out 150,000. We do the audit, we'll be 100,000 ahead. So we have to do the audit. Every jurisdiction's got to do it. But that one-time fee is in the contract services part of our budget this year, and it just goes towards that audit. And we're told that won't be an ongoing fee. We're told it's a one-time expense. So
It's quite a fine. Thank you very much. Living on Taylor Avenue, I can attest to those emergency calls coming from the Taylor station. Thank you again for your presentation. Thanks, Jeannie, for being here. Alderwoman, our Public Safety Chair has some questions.
No, just a comment. First of all, thank you, Madam Chair. Just personally like to thank you all for everything that you do, and it's incredible. And I want to thank you especially for your participation in 2022 for Annapolis United. You all were a very strategic part of that. The data proves it, no doubt about it. But as the not trifecta, but Q-factor, I guess, 4. Just want to thank you for that. And the residents and the businesses, thank you all for doing what you did in 2022. Really do appreciate it. Thanks so much.
Oh, I appreciate it. And yes, I get the privilege of being the fire chief here in the city of Annapolis, but it's the men and women in the Annapolis Fire Department that I work alongside of that makes us so great. I get the privilege to lead them, but working with them is what makes our department so great. The only other thing with our budget that I ask is that as you're going through, I know I discussed the public works when it comes to the upgrades of the stations, but also in public works is the fleet replacement part of the budget. There is money in there for a medic unit this year. It's taking 2 years. So our medic units, we try to get 5 years frontline, 2 years reserve time out of them. We're keeping them a little longer than that, but that's where we want to be. It takes 2 years to build something now. We have a fire engine on order, thanks to your support last year in the budget. That's on order. It's a 2-year build. We haven't even gone to the design part of that yet. So we ask that you continue to support that, because if that's not in this year's budget and it's taken 2 years to get it, it's really going to throw us off, and the amount of miles we're putting on these units every day. There's some other small support vehicles in there, but that's it. And I'll just give you a heads up that next year we're probably going to be looking at a big time item for one of our major pieces of equipment. So we'll work with finance to figure out the best way to try to fund that. And actually, I think we can probably try to get some stuff out of the state, because it's going to have to do with the fireboat. But the fireboat is aging. The fleet manager will probably come in and tell you it's starting to cost money. We've done very well with our boat. It's a very vital piece of equipment, especially with the shoreline we have in the city of Annapolis. And it's something that we are going to have to start looking at replacing here in the future.
So based on what my colleagues did several years ago, that all goes through the fleet manager?
Yes.
Yeah, okay.
Yeah.
Yeah. Well, if it's like buses, you could talk to Marcus. No. Anyways, since we have time, I'm just going to ask a general question for financial landscape here. Director Dickinson, when we compare the escalation to last year in projections, do we have any percent increase that escalation has? Could we state what escalation has done to the budget as far as staff? Is any? I don't mean to stump you, but just the financial landscape. We know that escalation has increased, and how does that affect our projections for fiscal year 24 versus fiscal year 23, or has it?
Are you saying you want the calculation of salaries and benefits and how quickly that's going up, or the percentage increase year to year?
Yeah, is there a general answer? I thought I didn't want anything really specific, or maybe I could just ask you, what is the escalation rate this projected fiscal year 24?
For salary and benefits?
Yeah.
Okay, so we do have a chart.
As you can see, it impacted the fire department budget, so I want the public to realize that factor.
So I will get you that.
Okay.
It's in the PowerPoint. We had a
Sorry.
No, not the percent itself.
Mm-hmm.
We had a schedule in there, a table that showed salary and benefits, 22, 23 projected, and what we're budgeting for 24. And that should give us the answer.
Yeah.
And we could also do it particularly by department if you wanted to break down by department as well.
Yeah. No, that's probably a good read just from the chart, numerator over denominator. Yeah, okay, denominator over
Yeah,
numerator.
yeah. So it's pretty quick, and I can get it to you in the next few minutes.
All righty, last call for questions? You good?
I'm good. Thank you, Chief.
Thank you.
Thank you very much.
Please take some snacks. You don't get any toys this year, you get food. No balls this year.
It's like they're choosing not to eat while they present.
Well, take them with you is what I'm saying to.
Break?
Yeah, I got, we're gonna break. We didn't make any plans for lunch.
Okay, so let's break it. Don't we have to recess?
We're gonna take we're gonna take about a 17, 18-minute recess, right?
Yes.
No.
No?
Gavel down.
The Finance Committee meeting is called to order for session number 2. This will be Parks and Recreation, and we have our new director and associates here. They will introduce themselves and begin.
Thank you. Good morning, Madam Chair. For the record, Rosalind Johnson, Director of Recreation and Parks.
Lakeisha Simmons, Recreation Division Chief.
Rodney Diller, Facilities, Parks Division Chief.
So we have a presentation we've prepared for you. Would you like for us to just start with the presentation? Okay, we'd be happy to do so. So we currently have 1 exempt staff person, 20 civil service, 8 contract, and 29 total employees. And we're thankful that budget helped us do a little bit of cleanup and move our staff to the appropriate places, so it was really reflective of the staffing that we have. We currently manage over 200 acres of parks, trails, and playgrounds throughout the city of Annapolis. More than 43 parks throughout the city are accessible for more than 200 hours of programming annually. We manage 8 facilities throughout the city of Annapolis, and we experienced a 387% increase in park usership in Anne Arundel County, and that was based on the COVID-19 Google mobility data. So our parks are literally bursting at the seams. We offer traditional recreation programs as well as unique programs such as fencing, the adult Easter egg hunt at night, and we facilitate other programs such as baton twirling. So Annapolis Recreation and Parks Department in our org chart, and actually I started with page 2, so I'll go back 1 just to share with you our vision statement. Our vision statement is to enhance the lives and wellness of all residents and communities. And in our mission statement, Recreation and Parks enriches the quality of life by providing recreational, educational, and wellness programs in facilities, parks, and waterways. And we wanted to share our philosophy with you all so you understand kind of where we're coming from. Our goal as the Recreation and Parks Department is to expose youth and adults to as many introductory recreational opportunities as possible so people can then determine their interest and then cultivate it more. So we are the exposure department, essentially. Of course, we report to the city manager. We have a Recreation Advisory Board and Art and Public Places Commission. Recreation programs, which falls under Ms. Lakeisha, aquatics, Stanton Center, childcare programs, camps and classes, and then under Rodney, Mr. Dillard, we have parks and facilities, and that's the Pitt Moyer Recreation Center, along with maintenance of all of our parks and facilities. Some highlights of FY23. We are working on upgrading basketball goals and adding 60 hours of recreation each week at Stanton. Childcare program started at a new site, Georgetown East Elementary, for PM Care, and we're at 100% capacity. We implemented the Homework Club, which transports students from Eastport Elementary to Pitt Moyer Monday through Thursday. Implemented a 5-week e-gaming league at Pitt Moyer, and that's your video games. That's what e-gaming is. We partnered with OEM and delivered over 10,000 boxes of non-perishable and perishable items during 52 food drives. That's 1 every week. We hosted 14 youth sports tournaments. We partnered with DPW and really want to publicly thank them to help us complete 6 concrete pads and 6 dugouts, which is 3 ball fields. We repaired nearly 30 light fixtures at Collison Field due to a power outage from a storm. We partnered with Anne Arundel County Health Department and hosted 52 vaccination clinics, and they're still ongoing. Partnered with American Red Cross and hosted 9 blood drives at Pitt Moyer. Greenscape in 2022 had more than 350 volunteers that participated in 64 projects and planted over 1,600 perennials, 3,600 spring bulbs, 27 shrubs, trees, vegetables, and herbs. And Annapolis United program initiated for Annapolis area youth. The golf program, 12 youth fully completed the program, 4 pop-up camps, 2 art, 1 drone, and a floating classroom. They participated in Annapolis Sailing School Camp. We had a field trip to Assateague Island, 50-plus kids in the summer, and then a field trip to Patriot Point, 25 youth in the summer as well. Now for our FY24 goals. We want to begin and substantially complete a citywide recreation and parks master plan. This will be the first that we can remember completing in recent times, and it will be a public process so that we can get input from the entire community and beyond, because we do serve many outside of Annapolis as well. We want to begin the Commission on Accredited Park and Recreation Agencies, which is CAPRA, and that is through National Recreation and Parks Association. This is the best way for us to do an audit of our department. It will ensure that we have policies and procedures, and we are a department of excellence when it comes to recreation and parks. Right now in the country, there are about 10,000 recreation and parks departments. About 196 are accredited. So this will move us up to the cream of the crop. Similarly, our police department is CALEA, and we want our recreation and parks department to be accredited as well. We want to increase safe water access at city waterfront parks. We're working on creating a partnership with Maryland Hall to provide classes at Pitt Moyer as well as Stanton. We want to create an official therapeutic recreation program to include an adaptive learning support group at Stanton. Right now, we don't have an official or structured therapeutic recreation program, and we want to be able to serve all residents of Annapolis and be able to meet them where they are. We want to implement science, technology, engineering, environment, arts, agriculture, and math, known as STEAM, but we want to turn it up a notch, and we want to do STE2A2M. And we would like for this program to be at Stanton, and the goal is to increase participation and get youth ready for college or trade school. If our youth aren't prepared for the future, we were just talking about this beforehand, if they're not prepared for the future as far as technology is concerned, then they're already behind. We want to create teen night programming. We do a great job 12 and under, but our teens kind of go away somewhere and then come back later when they're adults, and we program for them, but we want to provide the continuum of programming. We want to build the city's first universally accessible playground, which universally accessible is somewhat of a misnomer when you're talking about playgrounds, because you can't address every special need or ability, but you try to cast a wide net and be able to accommodate as many as possible. We want to increase accessibility to all communities by implementing free youth sports clinics. We want to audit our permit process to make changes and ensure there's equitable access to facilities. We want to create programming to enable disconnected youth in the city of Annapolis to learn to swim and be water safe. We have 17 miles of shoreline in Annapolis, and we are not doing our job as a Recreation and Parks Department if we're not preparing our most vulnerable residents to be able to swim and save their life. We want to be able to enable residents and visitors to register for programs and events online, including membership to Pitt Moyer. We're not carbon footprint friendly when you have to drive to Pitt Moyer to register for the very first time. So we want people to be able to do that from the privacy of their own home or their cell phone, wherever they may be. We want to seek out and obtain available grant opportunities for our department programs and facilities. And we want to ensure that we invest in our staff by providing appropriate training opportunities to include supporting staff in becoming CPRP, which is Certified Park and Recreation Professionals. And we want to work with the community to create a plan to develop Carl's Eltonia Beach to utilize the federal grant that the mayor and staff were so successful in obtaining. So our FY23 goals, where are we? We went through our goals as a team. Similarly, we went through our upcoming goals as a team, but we wanted to increase our membership fees by 5%, and we maintained that membership rate. We wanted to decrease non-performing programs by 10%, and we decreased all of our non-performing programs by 100%. And our current membership fee-based revenue was $203,000, and as of 4/10/23, it was $379,000. And we have positive revenue programs versus non-positive revenue programs. And then with our customer service, we wanted to provide customer service training to all Recreation and Parks employees. And so not all, but some of our employees received customer service training. And we wanted to upgrade our software to allow customers to conduct business online. And we are still in the process of that. And here are benchmarks with the number of full-time employees trained, the number of seasonal part-time employees trained, and currently, of course, we have 0 online transactions because that's still in process. We want to improve employee development. So we wanted to provide cross-training and employee development opportunities to all Recreation and Parks employees. That that goal was not met. We wanted to develop standard operating procedures in all ARP divisions. That was met in childcare, but not throughout our entire department. And again, us working on CAPRA accreditation will help us achieve this goal. And so training and employee development opportunities are being sought after, and we're currently working on updating our standard operating procedures. To increase our followers by 5% was our next goal. Currently, we have 10,000 plus fans and followers, 1,300 plus new fans and followers, and 1.1 million page and profile impressions, and 683,000 users, page and profile reach. So more than 27,000 followers on social media and subscribers to email communication is currently where we are. And then our FY25 to FY28 long-term goals. We want to develop educational programs hosted within Recreation and Parks facilities. We want to automate our point of sale process for all Recreation and Parks activities. We want to make all Recreation and Park facilities ADA compliant. We want to offer diverse programs and activities. We want to start environmental education programs. We want to create a lighted artificial turf linear field, which will give us longer playable hours. We won't have to shut down when we've had any type of rain or weather events. We would like to begin to measure and reduce our Recreation and Parks carbon footprint so we can be good stewards of the environment for generations to come. We would love to create a dog park here in the city of Annapolis, create a kayak share at multiple sites so that those people who don't have a vehicle or can't put a kayak on top of their vehicle can show up at a put-in location, borrow a kayak because they're a member of the program, put it in, and then place it right back into the slot at the site. We want to become a CAPRA certified organization by NRPA, which is the National Recreation and Parks Association. And we want to, and this is where Rodney's going to be jumping up and down, we want to create a staffing pattern that's reflective of the level of service expected by residents in our facilities and parks. We've expanded our facilities and parks, but our staffing hasn't kept up at the same rate. And Rodney's team, as well as Lakeisha's team, do a great job of trying to fill in, but we're at kind of a breaking point if we add anything else to the department. And we want to increase professional level certifications by 25% throughout the department. Now for our budget, for where we are, this is pretty much reflective of where we are. The art and public places, that money is in brackets, not because it's negative, but because it's not included in the 6.089 million. So that's why we put that number in brackets there. And let's see, we did have some new fees that we introduced, which is a lane rental, which is $36 per hour per lane for residents and $46 per hour per lane for non-residents. We've implemented a non-swimmer pool watcher, which is for typically parents or grandparents or guardians that will come in with swimmers, and that's $50 per swim season. And then a full pool rental, we've looked at our costs for that, and that's indicated with the $268 an hour plus $18 an hour per lifeguard, depending on the size of the event for residents, and $278 an hour plus $18 an hour per lifeguard, again, depending on the size of the event. Contractual services, we've seen an increase in our landscaping contract, an increase in Chesapeake officials, youth basketball officials at Stanton Center, and then an increase in youth basketball and adult softball contract. Our enhancement requests. Currently, we're looking at additional folding chairs, tables, a scissor lift, specifically at Pip Moyer, and hydro spinners. Those are aqua spinners. You can put them in the pool, and you can have spin classes right in the pool. They're similar to your spin bikes, but it's much better in the water because it's less stress on your knees and other parts of your body too, I'm sure. Programming and training. As mentioned earlier, we'd like to implement teen programming. We'd like to implement our STEAM program. We'd like for our staff to be more affiliated with our National Recreation and Parks Association via the conferences and trainings and webinars, as well as our Maryland Recreation and Parks Association. We would like for our staff to be able to attend summer camp training. And then athletic business also has trainings, and then staff development where we will bring trainers in to actually train our staff as well. And that concludes our presentation, and we will open up to questions.
Alderwoman Finlayson.
Thank you, and thank you, Ms. Johnson and your team. You, in your presentation, did not go over your performance measures.
Our performance measures from this year or last year?
Well, they're listed under each of your goals. Did I miss?
Oh, you're right. I did skip those.
Yes. So could you review those for us, please?
Absolutely. For performance measures, Annapolis Recreation and Parks dues and fees are comparable to similar municipalities with a voice of the customer input. So we look at customer feedback as well. And then Annapolis Recreation and Parks programs are consistent with the voice of the customer. And that's for goal 1. Mm-hmm. Goal 2, let's see. Goal 2, 80% of Annapolis full-time employees receive customer service training. We did not meet that goal.
I mean, you've been here for a whole, month?
Yes, I've been here for a month. And let's see, 25% of Annapolis part-time seasonal employees will receive customer service training. We did not meet that goal. And then 50% of our bookings and registration will be done online, and we did not meet that goal. I have had conversations with our MIT director, and we have a meeting actually later on today to discuss it. He and I spoke probably the first week that I was here, and we think our current registration will allow us to meet this goal. One of the pieces we need to, and we think we can do it, is have all of the addresses GIS'd in. So when a resident or non-resident puts their address in, the system will know, and they can register as a resident or non-resident. And there's some other components to the software that we think will address any concerns that we have. So we wanted to give our software another year to see if it can meet our needs. And then if not, then we will look at other software opportunities. But he and I both think that this current software will be able to do what we need it to do. And then for goal 3, performance measures, 25% of employees receive cross-training and developmental opportunities, and then 10 standard operating procedures have been updated. And we increased connections and public reach to 1,000 more residents and potential customers through community events and recreation and parks exposure. So thank you, Alderwoman Finlayson, for pointing that out. So those are our performance measures from this previous year, the current year.
Thank you. Couple questions about your budget. Under admin, can I assume that, and I don't know what the pay increase is for 25. I don't recall what, I know what we gave police, but what did everybody else get? And is this increase attributable to the negotiated agreements?
The pay increase, the cost of living increase for all employees is going to be 2.5%. And there are bonuses planned for all civil service and exempt employees of $3,000.
Okay, so that could well be attributed to the increase. And I'm looking at admin right now, but it could be any of the categories.
I'll let Katie provide any more detail. There may be things that are affecting the comparison as well.
And she's at the mic, ready to go.
Ready. Good morning, Katie Conley, Budget Manager. Director Johnson talked about the increases in the enhancement request that she spoke on. So about $110,000 of that increase is attributed to that.
In which category?
For administration. So all of her enhancements are in the administration division.
Okay, so we don't have a breakdown of what those are, but are they included in the mayor's budget?
Yes, ma'am. So if you don't mind going there. So that $80,000 and that $30,000 that you see there, those are included. It's also in the budget highlights section in the budget book as well.
Okay, great, thank you.
Yes, ma'am.
The cost of the pool, I hope is not increasing, the costs of entry into the pool.
No, ma'am, it is not.
Okay.
The costs will remain flat.
Ms. Simmons knows where I'm going with this. Every year, I want to make sure that we keep it affordable, so no increase on the cost of using our pool, going into the pool.
Absolutely not. And we would like to work with a partner to be able to fund the entire swim season next season so that it would be free, again, removing a barrier. But we'd like to replace that cost with a sponsorship.
That would be awesome. Annapolis Walk. Where are we? That's in Annapolis Park, Rexham Park. It's supposed to be resurfaced this month. Are we on track? And I know it's in the hands of Public Works, but it's a public park, and I want to make sure it's on track. And yes, this is my ward and my fight that I've been waging for a couple years now, so it's time.
Alderman Finlayson, Michael Malinoff, City Manager. It is in the CIP, and Public Works would be probably better off to answer that question because Rodney and I both looked at each other when you brought it up. Not to be disrespectful, but I don't have a current answer. I think it's on schedule, and it's certainly in the budget, but I don't have a current answer.
Okay, it is spring. I was promised spring. It's spring. So that's all I'm.
So the CIP drafted book has it still in the planning and design phases. And
No.
they've added.
Excuse me, I'm sorry to interrupt you, but that's not what we're talking about. We're not talking about for 25. We're talking about for 20, whatever year we're in now.
So when you look at each CIP page, it has the current status of each project that
I
would relate
understand
to
that.
right now.
I understand that, but the basketball court was supposed to be resurfaced this year, not for next year's CIP. So it's something that should be going on as we speak.
There, okay. I'll leave it to DPW because they're going to know more details about what's being done right now.
The CIP, when we met, the mayor and the director of DPW and Mr. Malinoff, they explained that it was in the CIP for 25. That is, we decided that was not sufficient and that it needed to be done this year, a year and a half later than it should have been. So anyway, Mr. Malinoff, if you will please follow up with that, I'd appreciate it. The pool, I understand there is an opportunity to add therapeutics to our pool, which was something I was interested in from the very inception of the pool. So can you speak briefly to the possibility and if that's anywhere in your long range or short range plans?
Yes, it is in our long range and short range plans. It's in both, and that includes us being able to deliver a therapeutic recreation program to the residents of Annapolis. The pool, we're fortunate that the pool was, when it was designed, it has a heater in it, and we currently keep it at about 88 degrees. So 88 to 92 degrees is your therapeutic water temperature. And so it would depend on the usage of the pool during non-peak hours and during early morning hours. Early morning hours is kind of the sweet spot for our older population to get out early and get back home early. So that is a possibility that we could have a therapeutic program in the morning. And then we will want to have one in the evening too. Many of our, I call our seniors active adults, but many of our active adults are still working. And so the evening times would be the peak times for them, and that would depend on the programming that we have currently planned for the pool.
Anne Arundel Medical, it's Luminous now, but they had offered to be partners with us and provide that service for us, so that they're a resource for you.
Absolutely. We will reach out to them and see how we would be able to partner with them. Perhaps they could meet their physical therapy participants at our pool during certain times, days and times of the week. So that's certainly a possibility.
That would be great. Thank you, thank you, thank you.
You're welcome.
Thank you, Madam Chair.
Yes, Alderman O'Neill.
Thank you very much. That was really quick, and I was madly trying to write, so I'm kind of going to be all over the place with a couple of questions. We talked about pool rental times for private pool rental. Is that the entire pool?
That's per lap lane. The entire pool rental was for swim meets. So that's on,
For swim meets
yes.
only? So if I was doing a birthday party, I couldn't have the opportunity to rent the entire pool?
You potentially could. There will be limited hours for pool party rentals. It would have to be outside of our normal programming time. So that is a possibility.
Okay. Thank you.
Sure.
And then you mentioned very early on food drives. Is that the same thing as what I call Food Fridays?
Yes, it is.
Okay. I appreciate that you mentioned that, but I'd also like to add, just so public know, that program is 100% volunteer run by, probably, I'm going to ruin a surprise if anyone's watching, 52 volunteers that are going to be recognized this Friday because it's National Volunteer Day on Thursday, but since our program is Friday. So I just wanted to make note of that. The online registration, you said you're currently working with software, and we have a goal of making it so that anybody could online register. Is that correct?
That's correct. That's our goal.
All right, and we're still working on that.
Yes.
Okay, and then lastly, in there you talked about a fully integrated, accessible playground. Is there currently an idea for location on that?
No, not yet. This was our team got together and we brainstormed and we were looking at what we felt was really kind of missing, where there were any type of gaps. So we don't have a location yet. We would like to meet with the community. We have a location in mind, but we want it to be a collaborative process.
Great. It is something that I have been on the bandwagon for since before I came on the council, and I would love to help in any way and participate. And I have a couple of community members that would be great for a committee that have reached out to me also on that aspect. So I just want to say that.
Thank you.
I would love to see that initiated, and there's been a lot of requests for it, especially in some of our elementary schools, children. There are several elementary school playgrounds that are fenced, but the fences currently are not always operable, which creates a hazard for some levels of children. I appreciate all of this, and one other question I had was last year, the, I'm going to totally, United Annapolis, Annapolis United, program was integrated into Rexham Park. Is that remaining there?
Currently, the budget has been moved to the mayor's office, and I'll let Mr. Malinoff respond.
Michael Malinoff, city manager and active adult. I relate. Councilwoman, the budget item is going to be addressed more in the next presentation by Kate Pettit, Chief of Staff of the Mayor's Office. In discussing the budget with the mayor, he wanted to continue the program, and it was one-time funded last year. So just by that definition, the decision was made to put it in the budget this year at the amount funded, but we weren't quite sure where to put it because of the transition from the former director to police department. So Kate is going to discuss that in her presentation. I'll be here, and we're not sure where it would be best managed and are open to discussion on it. I don't mean to be vague on it, but that's kind of where we are right now.
Okay, I appreciate that. Thank you very much. That's all. Thank you.
Thank you. I just have some that are sort of numbers related. The lap lane rentals in your presentation, I didn't see those in the fee schedule. Okay, just on top of things here.
Madam Chair,
Yes,
if you can, in the fee schedule, so in
Yes.
your binder, it's, I think, section C, page
Yes.
27 at the top. The amounts that are in, it looks like orange.
okay. So,
say page 27?
Yes, ma'am.
Under section.
In the fee section.
okay. Or does she have others then? I saw it in, okay.
So that's what's in red in the fee schedule?
No, let me see. Oh, they're right there at the end, okay. Got it, orange, yeah. Got it, okay. AIPPC, let's get this straight. They have funding, we've revised it so that we do not fund, so the public knows they have money guaranteed from the state every year. And so we do not fund them out of our general fund. This is to Director Dickinson, and I just, so is it, why would it be a deduct? It's just not in the number, right?
So so AIPPC
Yeah,
is was originally a function of Rec and Parks, trying to connect it with the department that would be most, have the closest nexus to what they do.
yeah,
So Rec and Parks is now, we had a temporary time when finance was processing their bills, but they now send their invoices to Rec and Parks again.
Okay.
And they are processing the payment of their invoices. Those expenses are determined by the board, by the AIPPC board, and then we process the payments as they direct us to.
okay, so the money coming in is from elsewhere, but we still are managing, they come under Parks and Recs for management
From a
of
functional
those funds,
basis,
on a
they're
functional
shown in the
basis.
Rec and Parks pages. But from, actually, they're a separate organization, just sending bills through us. And yes, they're funded by a portion of the occupancy tax now.
Yes.
You had said earlier, it's not
Yes.
funded by the general fund, but keep in mind, if the occupancy tax wasn't going to them, it would be going to the general fund.
Oh,
So
I
they,
got it, I got it, yeah.
in a way, this is a piece of the general fund revenues that have been
It's taken
allocated to
away from us,
AIPPC.
yeah,
Mhm.
touchy subject, yeah. Okay,
Madam Chair, it's been requested that we not use acronyms because the community doesn't know what AIPPC
Arts and
stands
Public
for.
Places, mhm.
Arts in Public Places Commission, yeah, it's a volunteer
Arts in
commission.
public, yeah.
Okay, okay. And that's your understanding of,
Yes, and our apologies if it was a little confusing. We put it in brackets because it's not in the addition of the 6.089 million. So if someone were to add up all those numbers, don't include the 156,000 to get the total $6,089,100.
okay. Do they have a staff liaison at their meetings like other commissions?
Yes, they do. I'm attending their meetings, and I believe there's
I'm hearing Brian Callahan.
Ashley.
Okay.
And Brian Kelly.
All right, okay, thank you. And the last question is, the harbor master is now no longer under your department. It's showing as a deduct. And obviously, it's a respective add to the city manager budget, just so the public is aware of that deduct. That's a management decision, correct?
Michael Malinoff, City Manager. Council Chair, yes, it's going to be presented in the city manager's budget upcoming.
Okay.
So it's no longer in Recreation and Parks.
Okay.
Ask about this. Where's front desk?
Oh, yeah, what happened to the front desk?
So the front desk is currently budgeted in Pip Moyer's budget.
Oh, okay.
So the facility budget there.
Yeah, that changed in FY '23. It was just a small budget that was 2 or 3 employees that worked the front desk and a couple of some supplies. And the department's got a lot of divisions. besides that, so we decided that we could lump it in with Pitt Moyer and not give it its own division since it's in that building.
And maybe I already said lastly, but the capital budget interface, there are a lot of parks added, Cars Beach for one, and so you have coordinated your staff with those efforts with, that's what you spoke to earlier, is that it's a
Yes, and we also believe the master plan that we're going to undergo this fiscal year will help us kind of right-size our staffing as it relates to additional parks and facilities. And so Eltonia Cars Beach is open, but it's not 100% fully activated. And so once it's activated, this we think will be a baseline year, but it will be a trial baseline year, that it won't be fully up and running with all the amenities. We are working with National Park Service to begin a master plan, not a master plan, I'm sorry, but a facility assessment, and try to work with the communities involved to see how we can best develop that park. So once it's complete, we anticipate there will be more staffing needs. And once we go through this year's kind of soft iteration, and then the full-blown iteration, we'll probably have phases with additional staff.
One thing that comes up in my ward and across Spa Creek is the I guess the line of demarcation, if you will, between the trails and the trees. In other words, the heavy tree work involved is not. My understanding is you can't do that.
That's correct.
Right? Do you know what I mean? Like at Truxton Park, for example, you maintain the trails, but once you get into the forest, or you don't get in, and the public has a hard time understanding that, and it's sort of a I don't know who does that. Do you have that in your parks at all, where your residents complain about the tree trimming and all that? No. Okay.
So Rodney can speak to that, but some of our light tree work, Rodney's team will take care of. For example, if it's a down tree in the park, we had a down tree on the tennis courts and the pickleball courts, and his team helped to remove that. So it depends on where it is, but I'll let Rodney speak to that.
So we work with Rodney Diller, Division Chief. We work with Brian Adams from downtown. He's the arborist, the city arborist. He gives us permission to do some work. But if the work is out of our range, we turn it over to him. If it's something if it's a complaint through a citizen, he do come in and trim trees like at Amos Garrett, the bigger ones, hanging over in the water. He have a company come in and trim those up. So that's the guy that you look for, Brian Adams downtown.
You know what I'm talking. I usually send those to you, the Amos Garrett, et cetera. Okay, that's all. I do want to say, wow. I mean, wow. You've only been here a month, and that's a lot of catch up to do. I mean, that was really impressive. I have to say that. So, thank you for informing her of everything. And go ahead, Rodney.
She's been totally awesome. I just put it on record. She's done an amazing job, and she made us step our game up a little bit.
Thank you. And in all fairness, I have a really great team to work with. So I think teamwork makes the dream work.
We have Alderman O'Neill has some follow-up.
Yes, I do have one other question that I missed in my notes, and it's about the childcare. And I see that it's less than it has been in the past. And I was wondering if, I know that there are a lot of people that have, because of the change in time for elementary schools, that are struggling to get aftercare, and should that be increasing? And our abilities to increase that?
We're bound, Lakeisha Simmons, Recreation Division Chief, we're bound by the maximum that we are allowed to have by the Office of Child Care. So at some of our sites, we're limited to the amount of children that we can have at those sites. Annapolis is a very small site. The area that we have there, we can only accommodate 15 children. And that is based on the amount of space that the school allows us to have. And with that, the Office of Child Care comes in and measures and says, you can only have this amount of children. So we would love to offer more spaces for children, but if the school has a limited space for us to be in, we're bound by those numbers from the Office of Child Care.
Okay, and do we have programs in all of our elementary schools?
No, currently we have it in 6 schools. We have it at West Annapolis, Annapolis Elementary, Germantown, Georgetown East, Mills Parole, and I'm missing one. I can't.
Tyler Heights?
No, we don't have it at Tyler Heights. We've tried to offer it there before, and registrations have been such that we weren't allowed to offer. We had maybe like 1 or 2 registrations, so we were not allowed,
How
we
about
couldn't run
Eastport?
it. Eastport, we're bound by, they don't have a space for us to be in, which is why this year we decided to do the homework club where we take children from Eastport and bring them to the Pip Moyer.
Okay. Thank you.
You're welcome.
Alderwoman Finlayson has some questions.
Actually, these questions come from one of our colleagues, Alderman Savage. The first question, I'm concerned about the lack of priority for competitive swim programs. Last year, the Masters Adult Swim Club practice was canceled, and there appears to be nothing this year. Also, there is the drama with the Penguin Youth Team. Can you explain why there has been this shift away from competitive swimming? That's the first question.
Yes, so first to address the first part of the question with adult master swim class in the morning. Last year, Riva Road Swim Center or Aquatic Center was undergoing construction. So we anticipated that we would have their users want to use our pools in the morning. So we didn't do the master class. We opened it up and we had a general lap swim to better accommodate the community, given that Riva Road was going to be closed. So that's the reason for that. And then the Penguin question for competitive swimming, we have offered several options to the Penguin swim team. We've offered 3 lanes, which is half of the pool, and then the public would have the other half of the pool. We then offered 4 lanes, which gives them the majority of the 6-lane lap pool. So they have 4 lanes. And they would like to have 5 lanes, which if they have 5 lanes, that would shut down one of our amenities. In order for us to fully operate all 3 sections of the pool, there's the slide pool, which is a 0 to 4 foot depth. There's the 6-lane lap swim pool, and then there's the splash pad. So in order to be in the 4-foot end of the pool where the slide is, you have to be swim tested. So that means you need a lane of the lap swim lanes to swim test those participants who want to slide down the slide. And then we'd like to keep another lane open for adult lap swim. So that's 2 lanes that we have to have open to keep all 3 sections of the aquatics facility open to the public. So we certainly do support the Penguins. We do support the competitive swim team. I will share that the Penguins, last year, there were 53 Annapolitans on the team and 87 members outside of Annapolis. So as a Recreation and Parks Department, we have to manage our resources to better serve all residents in the city of Annapolis, which means sometimes, we can't give people as much space as they'd like to have. They haven't done registration yet. Their registration is not complete, let me say that. So they don't know how many lanes they would currently need because they don't know how many participants they'll have on the swim team. Their swim team tryouts are May 30th, in which case that will determine who will be on the team. So I think that there's room for compromise on the Penguin side, where 4 lanes could be potentially made to work.
Well, let me ask you, so it's a competitive team, so just not anybody can be on the team. You got to try out for the team.
Absolutely correct, Alderwoman. You do have to try out on the team. Last year, we actually had to give 2 refunds to people who could not keep up and be on the team. And that goes with us balancing our resources. So should we ensure that the greater youth and adults in Annapolis are able to swim, which means we'd have to teach them how to swim, or at the very least have water safety classes, which we would have those classes during our peak times. We do offer some morning learn to swim classes, but the bulk of our community would like those evening times to be able to have those classes. Again, that goes back to our philosophy that I shared, where we want to expose everyone to everything in general. And then if they want to carry on and hone those skills, they need to look at other places such as Riva Road or such as Maryland Hall, if you want to be a fused glass artist or, a ballerina, sorry. So that's our goal, to really kind of work work with the vast majority of the community. But we do value the Penguins, and that's why we offer 3 lanes and 4 lanes.
There seems to be some misperception that they are a City of Annapolis team, but we don't have a swim team, do we?
No, the department currently has no teams. So we don't have a basketball team. We don't have a volleyball team. We offer our facilities for other people to utilize. So they would not be our City of Annapolis team. They traditionally, though, had been organized by our department. And they were organized by our department, and this is a carryover from the old pool that the City of Annapolis had. And that pool, obviously I wasn't here, but that pool, no one was kind of breaking down the doors to get into that pool. This is kind of a blessing and a curse that we have with the new pool, because it's probably, I would say it's one of the best looking and operating municipal pools I've seen, and I've been all over. It really reminds me of a country club. So Annapolitans are really fortunate that they have this amenity right in their community.
Well, I am extremely proud of the pool, so I'll just say that. What about capacity? You know, when, I don't know what the capacity is, but I understand that adults are required to be there with kids. How does that work? And with the swim team, talk about capacity.
Excellent question. So with our slide pool, the 0 to 4 foot, and that's really a 12 and under pool. Most adults will not get in that pool unless they're with their children.
Or it's
so
the
that
mayor.
pool,
The mayor got in that pool.
well, the first slide, yes. But that pool has a capacity of 125 is where we'd like to keep it for safety reasons. The lap swim pool has a capacity of 290. And then the splash pad has a capacity of 90. So we don't look at swimmers, we look at people who enter the gates. So for every parent that comes in with the swim team, that's one less swimmer that can come in. So there's a lot of things that are going on. First, AAU rules, and the swim team is a member of GASL, the Greater Annapolis Swim League, and they follow AAU. I've used that term so long, I don't know what it stands for, but it's an athletic group. And so they have a rule that no parents can be on the deck. So we try to follow AAU rules when people are utilizing our facility, which means they can't be on the deck, which will be the right side of the pool where the swim team is, which means they'd have to be on the left side of the pool. So if they're on the left side of the pool, then the public can't really be on the left side of the pool because they're taking up that space. So it's really a fine balance that we have to have.
Thank you.
Sure.
You clarified quite a bit. Another question from Alderman Savage. One of the FY24 performance measures is percentage increase of use by recreational players, and that's in quote. Please explain the metrics for the pool as far as if there has been an increase in recreational players for that facility from FY23 and 22, since competitive swimming programs were cut in FY23.
So recreational players, that's more of how many people register for our programs that we have. So we do have our summer camp swim programs during the day, and that has been, to my knowledge, fully maxed out when we have our summer camps visit our pool. The lap swim in the morning, lap swim starts about 6 a.m. and it goes until 10:30, and that's more of a drop-in, and that's remained consistent. We did have an increase last year because, as I mentioned, Riva Road was under construction, so a lot of those swimmers came to us during our 12-week summer. And then we were not allowed to have programs in the evening because the pool was essentially at capacity with the swim team utilizing all 5 of their lanes within a 6-lane lap pool. So that rendered us unable to have programs in the evenings. We would love to be able to have programs in the evenings such as water aerobics, aqua spin, learn to swim, water safety classes, the therapeutic walker, the pool walker program, but we just don't have the capacity in the pool if the Penguins were to use 4 or 5 lanes. Again, we could run those programs if the Penguins would limit to 3 lanes. They have half the pool and the public has the other half of the pool.
Well, that leads to another question, and I'm going to try to get to Alderman Savage. The hours of the pool, do we rent out the pool? You gave the information on use of the pool, rental of the pool. So people can have a party there and at the pool, rent the pool, a portion of the pool for their party. The swim team, I assume they're renting a portion that they want to use for their practices, I guess?
Yeah, so that is a conundrum for us. We've looked at other jurisdictions surrounding us to see when they rent their pools out, and they don't rent their pools out during their peak times, which traditionally is 4 p.m. to closing. For us, it's 4 p.m. to 7:45. The pool doesn't have lights, so a safe time for us to have everyone out of the pool is 7:45. After 8-ish, you start to kind of see shadows and things in the water, and it's just not safe. For us, we do have the pool rentals, but the rentals are during non-peak times. Jennifer has certain slots, and Jennifer is our aquatics manager. She has certain slots where people can have a birthday party, but they're limited to 25 because that does not overburden the public's access to the pool. And so there's only a certain number. So that's the rentals. And so when the Alderwoman also asked about our pool rental, that would be outside of our normal hours and if we have capacity. Because again, this is a well-used resource that the public has demanded use and access to. Traditionally during the summer, during our peak times, we'll have 1 in, 1 out, which means you can't go in until someone comes out because we're at capacity. So that's something that we would limit any rentals. We would probably forbid rentals during our peak time and then offer anyone who wants to rent the pool our non-peak hours.
Wow.
We already spoke to
Can I
Annapolis
read?
United, so.
Oh, okay.
Yeah.
The jump in supplies and others for the pool, the increase in costs of the pool, is there an increase in cost of the pool?
Yes, there was a slight increase, and that was, I believe, for the hydro spinners that we would like to purchase to do the aqua spin classes.
Oh, the contractual services.
And the other is contractual services, that's not up there. The increase in contractual services?
That's for the landscaping, for the pool.
Okay. And that's included?
The hydro spinners are
That's included in the mayor's budget?
Yes, it is.
Yes.
Yes, it is.
Okay.
And I'll add that our facility manager for the pool is so dedicated. She's even worked out an agreement with Mr. Dillard where her and her team actually mow the inside of the pool. She has bought wildflower seed to spread. She really runs that pool like it is a platinum country club. And I'm very thankful for the work that she does because she is super dedicated. I've been over there a couple times already, and she is over there sweeping with a regular house broom and dustpan, making sure that it is ready to go. So she's just phenomenal.
Well, thank you. And it's another Jennifer.
Yes, it is another Jennifer.
Okay.
All right, I think I've asked all of
Yeah,
Alderman
so
Savage's
you
questions.
do not have to provide a written response to those.
Okay, thank you.
Yeah, thank you.
Time-wise, we're about 7 minutes late. Alderwoman Pendle Charles, do you have questions?
No questions. Thank you so much,
Okay,
Chairman.
and Alderman Gay is here. Introduce yourself.
Thank you so much, Alderman Gay. I do have quick questions. I wrote them down, so I'll be very fast for the first one is the Stanton Center. I see the updates in the back of the book continuing as it relates to the roof, HVAC, etc. But one thing that I don't see is updates or increases to recreational program spending, field trips, sports officials. And that concerns me just because we know that serves a predominantly African-American community historically, and it's also been historically underfunded. Can you speak to that and maybe potentially requesting budget increases or delaying the purchase of hydro spinners and using that funding for recreational programming and field trips for the Stanton Center?
Sure. We're very fortunate that the mayor's budget has included our anticipated increases for Stanton Center. You'll notice for contractual services, the additional $1,000 is for the Chesapeake officials at the Stanton Center. And then if we look at our enhancements, going the wrong way. The programming and the training, that STEAM, STE2A2M, that is specifically for Stanton Center, as well as the team programming.
Is that online? I don't see that in
Is what online?
the Steam.
Oh, it's on the screen, I'm sorry.
Presentation.
Oh, okay. So that's just $30,000?
Yes.
And that'll last you the entire fiscal year for programming for the
With
Stanton
that
Center?
current budget, yes, we believe so. We believe it will. We also have some funds.
Can you just, because I missed it, I'm so sorry, but
Sure.
if you wouldn't mind maybe just sending me a breakdown so that I can follow up with you on, the exact programming, just because they're over time.
Sure, absolutely. We don't have those numbers yet. Our staff are working on it. They are doing the research to be able to get the information and the costs. We've looked at robotics kits and all sorts of other kits. And I think Mr. Malinoff.
So that's in-house, that's robotics. I used to do like Lego robotics and stuff like that. I think that's great. But I'm also thinking more out, like exposure to maybe community programming, and then exposure beyond that, field trips, museums, etc. Just things that, could change a child's life. And I think it's great, everything you presented so far. You've done a fantastic job, in particular,
Thank
since
you.
you've been here in such a short period of time. That's just something that I think, could be tweaked, but I'm also curious to see this. My next question was I didn't see reference to, in the capital improvement budget, the crosswalks, which I think was started under the Director Trader for the tennis court, or for the crosswalk from the tennis courts to what I think it's
At Truxton, you're
yeah.
referring to? Yes. I think Rodney can speak to that, or Mr. Malinoff.
City manager has a response?
City Manager, I did have one quick question for the director,
Oh, I
because
thought-
I don't think Alderman Gay was,
Oh, I thought you were responding
it
to
was,
his-
with respect to his questions, can you tell us what STE2A2M means?
Yes, of course. So it's science, technology,
Yeah, there's some for
engineering,
you.
environment, arts, agriculture, and math. And so this all ties in. We're fortunate enough to have someone who is very well versed in the environment on our staff. She is a horticulturist. She's also an arborist. And so getting her connected with Stanton so that she will be able to take the youth on environmental walks throughout their neighborhood, because, there's nature all around. So working with her on that, with the agriculture, working with Waterworks Park and the plan the mayor has for Waterworks Park with aquaponics and hydroponics and all those pieces, and then just tying the nature and agriculture piece into that. There are several opportunities there. And then working with our partners. So we've already reached out to Maryland Hall. We've met with Jackie Coleman and Mr. Starks, and they are super excited about partnering with us at Stanton, as well as at Pitt Moyer, and offering classes there. And they are under the impression they'll be able to find sponsors for that, because this is a relationship and a partnership that they haven't had before. And they think the demand is there, and there are people that would be interested in helping to pay for that as well.
And that's really good to hear. I'm excited about all the ag, all the environment. All of that's great, but it's local. And but what I would really appreciated about bringing you on as a candidate was that you had connections to bigger cities in these programs that they offer. And so I'm thinking big. I'm thinking let's reach out to the Baltimore Orioles. I know they have Umps Care, where you can send 50 kids down there. I think we were trying to do it last year, but there were issues with the transit, etc. And they'll, take care of. Let's reach out to what's his name, Steve Bisciotti, and Bisciotti, I forget his first name, and let's try to see how we can partner with the Baltimore Ravens, because I see that with these other Parks and Recs organizations, Montgomery County, Baltimore, etc., across the state. And I'm secretly envious, and I think it's something that we can do, and I think you are the right candidate to lead the team in that direction. And so I'm enthusiastic about your leadership. And for the record, our very first time talking was this past Friday, and so I think that you're fantastic.
Thank you. And the program that you're talking about with the Orioles, I helped create that when I was in
Awesome.
Baltimore
I didn't even
City
know-
with
yeah.
C4.
Okay.
And then the gentleman who is the new president of the Ravens, Mr. why can't I think of his name right now? But he's a graduate of
Mr. Brown?
Thank you. Yes, Mr. Brown, Sashi Brown. Thank you. He has been a partner. He was able to. We worked with Mr. Dick Cass to get $500,000 to sponsor a playground for us when I was in Baltimore County. So, Mr. Bashadi, I think his net worth just went up recently. It was something in the news about it. But he has really worked with youth around the state. So he's a great person for us to reach out to.
Yeah, and I think, like I said, you'd be the person to do that. So I follow up the crosswalks thing offline, but I just didn't see it in the book. Collins Field, I mentioned to you, I'm super interested in maybe even adding an amendment for a study here just to see what potential it has. The Alderwoman just mentioned that she was interested in a playground. You know, we talked about the spacing there, maybe not big enough for a rec field, but it can be converted to something so that we can maximize use and also increase revenue. I think that's the most important thing for recs and parks, just being able to rent fields, etc. I'll wrap it up. I'm done. And my last thing was just I'll follow with you. No teams, and then the pay increases for staff. And I'll meet offline with that.
Madam Chair, based on Alderman Gay's question, I'd like to ask one question. Mr. Malinoff or Director Johnson, I kind of tuned out a little bit. The mayor's budgeting will be including the Annapolis United program, but did I hear that the mayor's budget is going to also be absorbing something else within Rec and Parks?
No. Michael Malinoff, city manager. Harbor Master's office was what we were talking about, was absorbed in the city manager's budget this year through the transfer from recreation, but no other program that I can recall off the top of my head.
I will say this, Director Johnson, thank you so much for this wonderful presentation, and obviously you've inherited a great legacy, so thank you so much.
Thank you. I did. Thank you.
We'll allow you to ask a question, City Manager, if you have one. You were raising your hand before. Are you all set?
No, I was just following up on the acronym comment earlier made and was answered.
Okay, all right. According to our timekeeper, we're a little late for lunch. We're going to break for half an hour, and we will resume at 12:15 with a hard stop at 1:15. And have some snacks. We're not that mean.
Thank you very much, all of you.
Thank you so
Very
much. That was
informative.
really impressive.
Yeah.
I don't have to gavel or anything. No, we're good? Okay. Keep talking.
Thank you, Madam Chair. Thank you, committee members. Kate Pettit, Chief of Staff to Mayor Buckley, and thank you for the opportunity to present to you today on the Mayor's Office budget for the year ahead. I'll just go quickly through some aspects of our role and work. The Mayor's Office is a team currently of 6 people, including me. That includes the administrative support function to both the Mayor's side of the office and the City Manager side of the office. So we have, apart from myself, we have 4 other dedicated staff who work in community engagement, public information, constituent services, project support and community liaison. We work very closely with the City Manager and City departments to support program and project delivery in line with the Mayor's vision and goals. The Mayor's vision at the moment, we've been going around doing a kind of a overview presentation of priorities for the rest of the Mayor's term. And the Mayor's opening and focus in that presentation is that Annapolis is setting the pace in line with the Governor's vision for Maryland. And we are working to create a more sustainable, resilient, equitable and connected city where everyone knows they are valued and have a voice. So we have been working on significant projects in the past year, including rebuild of the Hillman Garage and all of the public information required to support that and parking arrangements downtown. We have been working on community projects such as the Choice Neighbourhoods Initiative, and we provide liaison services and all the communication support for that project. We have worked on a number of infrastructure projects, working with project teams in the city to help with planning, identifying funding sources, liaising with stakeholders and developing community engagement. Some of those projects include new parks and water access, such as Robert Eads Park. They include the College Creek Connector and the WE. They include our 100% mobility initiative, where we are working to provide transportation through the downtown area that would allow people to travel downtown without ever directly burning fossil fuels. They're just some of the major projects we've been working to deliver in the past year. We also support events, and I'll talk about some of those in a moment. We also provide liaison and communication support services to the council, to city departments, to boards and commissions, and we administer 2 community service and engagement programs currently, which I will talk about. There's a 3rd one there called Startup Annapolis, which has been traditionally on our books. So the NAM program, I'll just talk you through those 3. The NAM program is our substance abuse prevention program, and that is funded through the opioid program run out of OEM. It is grant funded, and that money comes to the Mayor's Office to deliver Naptown Anti-Dope Movement, which is a program that's designed to raise awareness about substance abuse disorder, connect services to residents, and to provide intervention. So we distribute Narcan through that program as well. That program is run out of the Mayor's Office with the intention of being a trusted voice on the ground in the community. So when we engage people in these programs, we try to engage people who have relationships and connections in communities and can build those. I'll talk a little bit more about what NAM's been doing, and we'll report on that for you as well when OEM present and talk about the opioid intervention operation of the city, because we fold into that and work with them. The No Harm program that we run is an initiative that the council funded last year with money of a budget of $80,000. The intention of that program was to seed a violence interruption program in Annapolis. We worked with the county last year in partnership to develop a violence assessment, which we held in August. And some of you, I think at least 2 of you attended, or more of you attended that one at the Pip Moyer Recreation Centre. Out of that assessment, the county identified critical areas for violence, where a violence interruption program could operate, and one of those was at Robinwood. So the county has not funded a joint outreach program at this stage, so that we have employed 2 community engagement workers who are working exclusively in Robinwood to deliver violence prevention programs, including education workshops, connection to services, youth outreach. And the idea is that we will seed a community to run violence interruption. You may remember from the workshop last year, you need trusted people on the ground who are in communities 24/7. The idea with No Harm is that we begin to seed that presence, we begin to build relationships in the community. I'll talk a little bit more about some of the things they're delivering in a minute. And the idea is that when the county is ready to fund this program, we will be ready. And we're working in strategic partnership with the county's Gun Violence Intervention Task Force. And as I'm sure you're aware, gun violence prevention has been a big initiative of the mayor throughout his time in office. So that's a bit about some of the things we're delivering on the ground and have been delivering in the past year. Some of the outcomes. I've just highlighted a few things here, some of which I've already mentioned. The Mayor's Office has planned, coordinated and organised a number of flagship events this year. We've done at least 6 flagship events, including Rodney Barnes' Key to the City presentation last year at Maryland Hall, the Capital Gazette commemoration at the Guardians Memorial and here at City Hall last June, the Cars Elktonia signing in August, which was a major event with federal, state, county partners, media from all over the region, and many, many community stakeholders. We facilitate the City Hall Open Day every year. We had a very successful Black History Month celebration here in the council chamber for the first time here in the council chamber in February. It was a wonderful celebration that culminated our month of Black History initiatives and programs. And we are currently preparing for the Hillman Garage opening, which will happen this year, I'm pleased to say. So more coming on that. As I mentioned, our community engagement programs on the ground, NAM and No Harm. We have delivered 4 community fairs, 11 community workshops. Many of them are targeted at children or young teens to help them, connect with resources, awareness. We've conducted 4 listening sessions. And in addition, we do a lot of protocol events. So there have been 6 major press conferences this year with state partners, federal partners. We've had 4 diplomatic visits from partners in China, Czechoslovakia, and the Netherlands. And we facilitate intergovernmental meetings so that the city works closely with state and county in particular, and we try to foster those relationships. I mentioned our community programs, NAM and No Harm, and some of the major projects which I've mentioned, including the Choice Neighbourhoods Initiative with HACA, our downtown parking program of public information, trails and access projects, festivals and city events such as the Songwriters Festival, which the Mayor's Office worked very hard to support the implementation of our first Songwriters Festival last year, and 100% electric, which I mentioned, our alternative sustainable mobility program. In this year, we saw bird bikes and scooters introduced. We've seen 2 electric golf carts, which now provide a downtown loop. And we recently supported the teams who worked to secure the ferry grant of $3 million. So we've been closely involved in that planning effort as well. On the communication and public information side, the Mayor's Office coordinates the City Studio, which provides all our live streaming and broadcast services. This year, we'll deliver over 1,000 live broadcasts, including council, board and commission meetings. And that will amount to over 220,000 video views by residents who can join us live or who can watch our telecasts, our meetings after the event. We've produced over 600 City Council citations. That's almost 2 citations every day of the year. 40 city proclamations, more than 150 press releases, more than 130 speeches. I mentioned the live broadcasts. Over 430 individual design products to support various projects. And all of that comes down to when we put our engagement out online through social media, City Facebook, YouTube, and Twitter, we will have over 385,000 social media engagements with residents directly through the year that are all managed and coordinated and supported by the PIO. Our constituent services is another really critical area of operation for us. This year we recruited a new Assistant Equity Ombudsman to support the current City Ombudsman to view all our resident interactions from an equity lens. Equity, of course, is another critical goal of the Mayor. We've managed over 1,000 resident cases. We have continued to reduce vacancy rates for city boards and commissions and ensure an equitable representation on those bodies. We have migrated boards and commissions data to a new online system to find efficiencies and to be able to do that work more consistently and in a more timely fashion, and to better facilitate training for members of boards and commissions. Members of our constituent services team are always out in the community. In the past year, they have attended over 15 community meetings and conducted around 50 field visits. So they are just some of the things that have kept us busy this year. And then just quickly to flag our priorities over the next year. As I mentioned earlier, the Mayor is presenting currently to our state partners. We've presented to the new Governor's team. We hope to present to some of the Cabinet Secretaries in the coming weeks. We've starting to present to community organisations, an overview of all the priorities that we will be working to support in the next year and in the rest of the Mayor's term. And as I mentioned at the beginning, the theme of this presentation is how we are setting the pace in Annapolis. And I'd like to acknowledge that the Mayor doesn't do this without support. And, I think last year when I was here for the first time, I referenced the very successful election. It's very clear from the council that we have that this progressive vision is valued by our residents, and we know that we do that in partnership with you. So there are projects of national and international significance that the Mayor is working to deliver, and they include, of course, our reimagined City Dock, which is a project about sustainability, flood prevention, managing climate change. It's a project about culture, as the new City Dock will celebrate the diverse history of many people who have contributed to making Annapolis what it is today, from the original settlers and those enslaved persons who were brought here against their will and who built the fabric of our city, to the watermen and the oyster farmers and crabbers and so on who told that story of the water, or built that story of the water here in Annapolis. And the new City Dock Park will honour all of that legacy. It's also about connection as we work to create a waterfront welcome centre that will provide a home for the National Park Service, that will tell some of that history, and that will provide a gateway to the Bay, as now more and more jurisdictions are looking at the water as a viable means of transit and looking at ferry options that will connect us to the region. So that's kind of that broad vision for City Dock. The CARS Elktonia beach story, as you all know, is a really significant story of African American culture in this area during the years of segregation, and continuing to develop the CARS Elktonia beach site, ensuring that we can create a meaningful visitors centre there and a meaningful visitors experience that we can have road, water and pedestrian access, that we can connect to the surrounding parks, is all part of the next phase. And we continue to have work to do to raise funds and to develop that plan. And then the last piece of this is the Annapolis Alternative Mobility Plan. And this is a comprehensive plan that really brings together all of the infrastructure across the city, the trails, the parks, the water, and connecting them all through sustainable transit. And this will mean that we will have trails that will allow pedestrian and biking access from the west to the north to the southeast of our city, the College Creek Connector, the Wee, trails through Truxton Park around to Hawkins Cove, and new access, particularly for underserved communities, such as the communities at Bloomsbury Square, communities living at Hawkins Cove, communities around the Stanton Centre and Clay Street in the Old Fourth Ward. And of course, all of those electric options that allow you to travel and alternative transport options that allow you to travel across our city cheaply, conveniently and easily. Together, these projects represent a vision for a city that's connected physically and as a community that celebrates all stories and history with access, economic opportunity and mobility for all. And at that point in my presentation, that's kind of the overview of what we do, where we're heading. And next I will go to our budget proposal for the year ahead, and I'll just pause in case there's any questions at this point.
So far, any questions so far, colleagues?
May I? I guess my only question is about the budget. That's your next slide. Are all of these enhancements included in the mayor's budget?
Yes. Yes, so these, I would like, yes, I was going to just talk you through now, so.
Oh, okay, then I don't want to interrupt. I thought you were finished.
I'm happy to talk you those two through. So these are all of the enhancements. The mayor's budget otherwise is unchanged with a small, a small weighting for, increase in cost. And these are the differences between last year and this year. So the major one is some salaries and benefits. We are asking for a new contract part-time position to support public information delivery. We have one public information officer who works for the whole city. About her work breakdown comes to around 70% is city-related business, where she's working directly with departments to support projects, initiatives, services, timely information, emergency information to residents. About 30% of her time is taken in support for what I would call our diplomatic functions to do with speech writing, press releases, and of course she oversees the studio. The work I can vouch for the fact that our PIO is by far the busiest person I see working in the city. She has a very large workload. And for some time, even before my arrival, I've been in this role for a year, there has been talk of how we support that position. So there's a workload issue here around ensuring that the increased workload as we work to deliver these continuing significant projects. The CityDoc project is going to require a huge public information effort. There will be specialised products, there will be a whole specialised communication plan, we'll be working with businesses, we'll be working with residents, and that will be ongoing for the life of that project and require a huge, public information effort. The Choice Neighbourhoods Initiative is continuing over the next 2 years. Our PIO has been asked to provide, she provides pretty much all of the communication, including managing the CNI website, writing the CNI newsletters. She attends all those meetings. With all the other projects we have that will also require a huge effort, the workload of the PIO is increasing, not diminishing. We're also beginning to look at where we need to develop new social media engagement and outreach to reach a younger audience. So if we can get this additional resource, that will provide us an opportunity to look at platforms that engage young residents and communicate more directly with that audience. So the workload, which is already very significant, is going to increase. And there is also a continuity requirement or pressure, because currently our PIO is the only person who has the knowledge and skills to do all parts of the job. When she goes on leave, I don't think she has ever had a period of leave in the city that she hasn't had to stop interrupt her activities to attend to something at the city. Now, sometimes it's routine. It could be social media scheduling, and that just has to be monitored and managed. It could be media inquiries that come through any time. It could also be an emergency that happens, and suddenly you have to drop everything and deal with that emergency. But if she is out of the office, I am able to look after some aspects of that role, but there is no one who is trained and able to manage all of that role. So this additional position is largely about helping us ensure that we have continuity of service and that we are planning for that need, so that the city doesn't, if our PIO was experiencing some sort of emergency and wasn't able to attend to something, city operations will not suffer as a result of that. So they are the main drivers.
Sorry, did you say will or will not suffer?
And so if by chance the PIO was not available, in her own emergency, city operations would not suffer, because we would have a backup person. Excuse me, drink of water. We would have a backup person who could ensure information would continue to be delivered.
Okay, thank you.
The next position, shall I continue at this point?
Yes, we'll
Sure.
save questions to the end. I just didn't hear you.
All right, terrific. So the next position that we have included in the budget this year is the Assistant Ombudsman for Equity. This was a one-time funded position sponsored by the council last year. The position was filled at the beginning of this year, and the Assistant Ombudsman works with our Constituent Services Officer and City Ombudsman to review resident cases with a particular lens for equity. It ties back again to that vision and policy that we have, and so we are looking to identify those points where we can, wherever there's an equity issue, whether it be financial, cultural, whether you are someone who is simply new to Annapolis and has trouble navigating our services, gender-related, whatever the issue is, we are trying to build a database to capture those issues. That work is not complete yet, and we would like to, we operated as it was a one-off funded position, but we would like to ask for that position to continue as a contract position under the same hours and same rate of pay that is currently being funded. Then we have, for our contract services, we are asking for $30,000 over 2 years to support the Choice Neighbourhoods Initiative. That is largely to support not just communication costs, but some of the studio and live streaming costs, all of the costs the city bears. We had $20,000 to support that project last year. That was a special item in the budget. And now we're asking for $30,000 to cover the next 2 years. We anticipate something like, $15,000 to $20,000 in 2024, and a smaller amount in the following year as the program moves towards finalisation.
May I interrupt? I didn't want to stump you, but on special projects, I'm following in the budget, and the numbers on page 39 don't align. The Butler statue, for example, is at $190,000.
So, yes, so I think I
Versus
can
10.
help with that. The $10,000 that we are proposing to be included in the budget is really seed money for the planning and consultation phase that will need to be undertaken. So this is a statute that has been proposed by the Caucus of African Americans to honour the first African American elected who was elected as an elected official in the state of Maryland, and the caucus is proposing that they can raise the funds to cover the cost of the statue, but they have partnering with us and asked that we would help seed the planning, design, and consultation to get that project moving. So I think Katie might talk to us more about the overall cost.
Ms. Connolly?
Yes, Katie Connolly, budget manager. That is a typo that you see in the budget book. The total is 190, but the breakdown provided on the screen is accurate.
So the screen is correct?
Yes, ma'am.
Okay.
We'll provide a revised page.
Thank you.
Our apologies.
No worries.
Thanks, Katie. Yeah, so, but as I said, that $10,000 will not cover the full cost of the project, so it's really seed money to get that started. The other item that we have, of course, is, and I can see there's a typo here, with No Harm. In the last year, the council funded No Harm to the amount of $80,000. We're asking for the same amount again. The program is up and running very successfully. We employ 2 part-time community engagement workers. One works full-time during the day not full-time, I'm sorry, she's part-time. She works during the day out of Robinwood. The other works out of hours out of Robinwood, based at the resource centre. And the out-of-hours component is a particularly critical part of moving towards a true violence disruption model, because you need presence in communities beyond the 9 to 5. So the program is delivering workshops, listening sessions, and activities targeted largely towards youth between the ages of 10 and 14 at the moment. We see a need to work to include older teens as we go forward, and there is some thinking around how we may do that in conjunction with the county initiative once we get clarification from the county exactly what they will be funding and how that will look in Annapolis. And also, if Annapolis United is to continue, which I'll talk to in a moment, we can see ways we can work with that program to look at programming that targets our youth in particular. And then finally, the Annapolis United program is here in the Mayor's office as a placeholder. It's been a very successful program. The Mayor supports ongoing funding. It was funded as a one-off program last year, but we do not anticipate the Mayor's office administering this program. It's really here as a placeholder while the Mayor and the City Manager negotiate where that program lives, how it will be delivered. And I believe there's some conversations with a couple of departments on that. So it's really sitting here until we resolve the long-term arrangements for that program. And as I mentioned, we have a general increase in our annual cost and service demands. So that's the last item.
Okay. Colleagues, questions? Alderwoman Finlayson?
Yes, thank you, Madam Chair. So the Annapolis United, I'm going to start from the bottom and go up, isn't a program yet, but we have a placeholder for $100,000 in the mayor's budget that he has funded in his budget?
Yes, and I'm going to ask the City Manager to talk to a little bit more about this, because we are committed. I guess the Mayor's office is very committed to ensuring we have programs that reach youth, that help us to meet our public safety, violence prevention goals. And we would need to work with, we're running No Harm. We would want to continue working with the APD, with the Public Safety Committee, with Rec and Parks as appropriate on programming that meets that need. But Annapolis United was not our program, and so we're not proposing to take it over. We believe our departments may be better to deliver the hands-on operational work that would come out of a program like that, and the services and activities that would come out of a program like that. But we support that philosophically. So the Mayor has been willing to give this budget a home while we resolve the long-term issue.
I guess I'm still not clear on exactly what it is. And maybe Mr. Malinoff can help me. Because what I'm hearing, it's a little piece of NAM, it's a little piece of No Harm. Why a separate project or program? Or Annapolis United is what we're talking about, the $100,000.
Correct. Michael Malinoff, City Manager. Councilwoman, Annapolis United is the continuation of the program from last year that was in Recs and Parks that was one-time funded. And so the mayor, as Kate had mentioned, wanted to include it in the budget. We just weren't sure with the movement of the former director into the police department where the program should end up. It'll be essentially, and I'm not going to say what the design will be because I wasn't that familiar with how it was designed and who was managing it beyond the former rec director, but that's why we wanted to keep it in the budget and then decide where it would go.
So this was the program that dealt with camps, am I correct?
Correct.
I believe so.
Okay, that was in Recs and Parks.
Correct.
Can we also
Okay.
have just in Recs and Parks? I didn't know.
Is any of the funding, and we just heard from Recs and Parks,
know.
is any of the funding for One Annapolis and Recs and Park?
Of the previous, no.
So this is all of the funding for One Annapolis,
For Annapolis United.
or for Annapolis United, yes?
Correct.
Okay. All right, we just need to be clear. I would like to see data to support the effectiveness of the programs that we've funded in the past, so that we can decide whether we want to continue funding them. And I'm not speaking for or against, I just think we should be able to see that programs are working as they were intended.
Yes. Sorry, Alderman, I didn't mean to interrupt you, but we're going to give you a full report on NAM, the Naptown Anti-Dope Movement, when OEM present, because it's operated out of the Mayor's office, but it's funded as part of our overall opioid intervention team. And so the overall opioid intervention targets apply, and I can talk to you through some of the specifics with NAM, for example. It's much more personal based on the ground service day to day. We have a community engagement officer who works out in Robinwood and Eastport, Harbour House, Stanton Centre, working closely and engaging directly with people on the ground. She's distributed over 300 doses of Narcan in the past year and run a number of our community engagement fairs and listening sessions. And she's the data on the ground of how our opioid intervention programs are working is very solid. So we will present, you will see some of the data on NAM when we present on the opioid intervention program.
And I think we would all find that very valuable for all of the programs.
Sorry, I'll just add to that. I have asked for the No Harm team to be able to come and present to the council at an upcoming work session. I'm not sure what date that will be, but it's fairly new. We've been operating that since January, so we've been planning the program, developing the initiatives and the workshops, and we'd like to come and present to the whole council to give you the detail on the ground of what we're doing and what our targets and goals are and where we hope to make a difference.
That would be appreciated. Won't help us, I don't think, with our budget deliberations, but the mayor's already included it, so I guess there's not a lot of debate about that. I'm looking at the PIO position. And you said that we don't have a backup. We do have a PIO in the police department, and we did have one, and I think we still do in the fire department. And there used to be a collaborative arrangement between those three so that we're never left unprotected. So does that not exist any longer?
I think it does, Alderwoman. Yes, it does. And so the police department PIO is, I believe, sort of the second is back up to the city PIO. The police PIO position was only recently filled at the start of the year, so that has been a bit of a gap. So we do try and ensure that there's a PIO network and backup arrangements. But inevitably, there are just some things that always come home to the city PIO and people who are contacting the city PIO for information, for support, for services. So there is that pressure always on the position, but we do try to work with the departments collaboratively to help. And that is one of the main ways we are managing at the moment. But it's not filling all of our gaps.
Okay, the arguments have been in support of those positions for the express purpose of being, working together in the city. But I'll move on. The assistant ombudsman, did we hire the ombudsman / diversity person? And is that a full-time position, or under what parameters was that position filled?
That is a part-time position of 29 hours a week, I believe. And so yes, we have hired that.
So it's a contract position?
Yeah. It's currently a, the word is escaping me. It's not contract, what's the other? Yeah, it's a temporary. It was a temporary one-time funded position, so we're asking to continue that on a contractual basis.
So this funding that's included in the budget will make it a full-time FTE, regular? No?
It will remain a part-time position. It will remain the same hours and the same salary. It will just allow us to continue the work through the calendar year.
So what was funded last year for a part-time position was $34,000, and now we're adding $34,000 to the FY25 budget, or is it 24 budget?
FY24 budget.
I know, I'm going ahead, Katie. I'm just moving ahead. Okay, Katie, I'm sorry. Ms. Connolly, I apologize.
No worries. Last year, we used one-time funds. $34,000 of one-time funding last year for this position, and they would like to continue it in 24. I almost said 25. So we are again putting funding in, but not using one-time as the funding source. We're using recurring funds.
So that was the key word, one-time funding. Okay, great. Do we still have an African-American liaison and a Hispanic liaison?
We do still have African-American liaison. Hispanic liaison function moved with the change last year in the budget. So Ms. Gutierrez, who operates the Office of Community Services, still oversees Hispanic liaison. She has a team employed specifically to do that work that are grant funded.
Okay. I think that exhausts my questions. Thank you very much. Mr. Malinoff, it's...
Michael Malinoff, City Manager, Council Member. I did want to mention with the ombudsperson position, is there's going to be a memo coming out from Ms. Rastovich about trying to collect all the council issues through that office for that purpose. We've formulated something. I don't know when she's presenting. She had mentioned she was going to present to you all on it. And the idea is that when you get a complaint or a question that you send through us, that we'll also be able to put it through that filter in total, and then have a tracking spreadsheet that you can follow.
Mm-hmm.
And I believe they'll be presenting at Thursday's work session to talk to you about that.
That would be appreciated. Thank you.
Yes, I did have a question. Now I can't find it. Oh my goodness. In just trying to, do you have a copy? Sorry, I can't think straight. performance measures. Talking about, you said the NAM will be their performance measures will be presented with OEM. Is that the same with the no harm?
No harm. I would like them to come and I would like the team to come and speak and present to council, and I'd like that to happen before the budget deliberations are over, so you do have all the information. The no harm performance measures are essentially around targeting outreach in Robinwood at the moment. That's where they're based. They're based exclusively in Robinwood. The violence interruption model is about local trusted voices on the ground. So I can talk you through some of the things that they are working towards. They essentially working to deliver a range of informational workshops. 2 will be targeted to adults and 2 will be targeted to youth. There are 2 community listening sessions to be held between now and June. One of those has already taken place. At least 2 of our workshops have already taken place as well. We have a range of engagement activities for youth, including art, e-gaming, and sporting events. This is where I think it will be good to bring a strategic eye between the work we're doing on the ground targeting Robinwood and a broader program if Annapolis United is to continue, and how we ensure alignment there. But the work we're doing for no harm is targeted in Robinwood. There are targets for how many youth referrals we will achieve over the year, how many adult referrals we relieve, and how many people we hope to complete an anti-violence program. So these are sort of the goals that the program has set. It's only been in operation since January. So we're not quite ready to report on outcomes yet, but I would like the team to come and give you a presentation on the goals, the deliverables, what they're working towards between now and June, and then how we plan to measure the program. One of the things we're doing is developing a survey, a community survey, that will be administered before May, and then re-administer that survey to report back to you ahead of budget deliberations or by the end of the year.
Okay. And I guess going along with that, also performance measures for the Annapolis United's, I know that we gave them a one-time budget that I don't remember off the top of my head. I thought it was around 185, and now we're asking for 100. So do we know, is the 100 merely just a placeholder, or is it based on what we did use? And do we have numbers as far as how many were served?
I believe Annapolis United provided a comprehensive report. I don't believe, I know they did provide a comprehensive report around how many youth they had reached, and some of their outcomes back to the council in February or March, I think that was.
It was our February public safety meeting for almost 3 hours.
Yes, thanks, Alderman Pendle-Charles. As I said before, this is here in the Mayor's budget as a placeholder. We really believe in the goals of this program, but we want to make sure, I see the role of the Mayor's office is working to make sure we have alignment and minimise duplication of effort across all our safety, violence prevention, diversion programming. So, no, I'm not going to be overseeing Annapolis United. People in my team will not be, but we will work closely with whoever is administering that program, as we did last year.
Okay, thank you. And I guess my last is that you talked about, NAM, and the information workshops and the art and gaming and sporting. That sounds a lot like what we're also doing in Rexon Park.
So there is some, yes, we work closely with Rec and Parks. When Rec and Parks or when other community engagement events or initiatives are happening, the NAM program, which is our substance abuse prevention program, typically partners. We work very closely with the Office of Community Services. We work closely with Rec and Parks and with other community partners. The reason NAM lives in the Mayor's office rather than out with, another department is that it is about raising awareness and using the profile of the Mayor's office to raise awareness on substance use prevention, abuse prevention. And the other part of this that the Mayor's office brings is we work to employ community engagement people who are known in their communities. So we work, they're not firefighters, they're not police officers, they're not city officials per se, they're people who are known and trusted on the ground in the community, and that's a big focus for the work we do in NAM. It's building relationships and trust, and then connecting people to the broader services as well.
Okay, thank you.
Okay, I'm a little confused, and I'm glad Alderwoman Pendle Charles is here. I know last year there was an amendment for $100,000 for Parks and Recs, and it was called it was a pilot prevention program. I thought that was under the umbrella of Annapolis United.
I think we need to kind of back up a little bit. And I'm always going to try to give the history, because just for the viewing public as well. I think it helps to, I'm sorry.
Let me tell you the question, and then you can frame it to address the question. Is there interface money-wise between Parks and Recs and the mayor's office? I can't help but think that there is, because of all the money in camps and everything. In
Not to my knowledge.
Okay. Okay.
If you all recall, I'll be honest, I'm very confused, but that's
Oh, no, if you are.
a whole nother ballgame. Last year, January, February to mid-March, we had a severe uptick in violence, shootings, and that sort of thing, inundated with emails and all of that. If you all recall, I gave my 1-hour State of the Public City address on public safety. That night, and I'm going to be quite candid at all, that night around midnight, former Director Trader, at that time Director Trader, contacted me and said, what are we going to do? Something needs to be done. And I said, you're right. So the next morning, we looped in the police chief at that time, Chief Jackson, and we came up with the Annapolis United. Annapolis United was, at that point, was targeted to address the immediate problem that we had with all the crime going on. It was out of control, no doubt. We had a homicide in January. So we decided at that point we're going to do Annapolis United. That was March 15th. What we did was, the first thing we decided to do was Annapolis Most Wanted. And we did that, I think it was 2 weeks later, April the 1st. We had it at the Stanton Center. It was the mayor, chief, and myself. Mr. Trader was there as well. We each gave a presentation. Mr. Trader was on the sidelines. And within 24 hours, a gentleman who had handgun charges and related charges turned himself in. At that point, we knew we were onto something. And from there, we decided that we needed to engage the children, the community, and the families into a program that would address violence. And we looked at police department, fire department, Office of Emergency Management, and the Rec and Parks. Annapolis United, Rec and Parks, Love Our Children, Office of Emergency Management, Love Our Neighbors, fire department, Peace is Here, and police department, Stop the Violence. So they each had a piece of this entire program. Mr. Trader had offered up $185 because that's the budget he came up with, Dr. Vance, who assisted him at the time. What we did was, we felt like, because the money did not come to fruition until July 1st, that we could not start anything until July the 1st. So we had to compress as many activities and events and opportunities for these children to be engaged, especially once school was out. We had to compress pretty much everything between then and mid-October. By mid-October, school was in session, of course. The weather was starting to get, weather was not conducive to outdoor and the activities we were looking toward. At that last activity was Mr. Adatola's activity with Ms. Tiona, which was in December. Then what happened was we decided during that time period, during the winter time, that we would put together a presentation, which was almost 3 hours, to Public Safety Committee. It was very comprehensive, and Alderman O'Neill and Alderman Gay were there and heard the entire presentation from all 4 departments. At that time, what we decided to do once the presentation was over, to take up and do some more events and activities, especially during spring break and all the other things coming along through March, April, May, and June. And by the end of June, the entire 185 would be utilized. I did have a conversation with Mr. Malinoff, and I think they were not thinking maybe or didn't realize that the programming somewhat stopped. I think there was one program in March where they took the children to the Wizards game, but we had a lot of photographs and everything for the summer, for the fall, and coming into the winter. And so there was not an allowance of saying, okay, we're going to use this money towards the end of the year and be utilized by the end of June. So that's kind of the short and long and dirty of it all. It was a shock, surprise to me as far as the money being housed in the mayor's office, because the resources are in Rec and Parks. You have Miss Lakeisha, who really was the person who oversaw it all. You have the vans, the buses, and Mr. Chucky and all those people who ran the program in Rec and Parks. I don't know logistically, and I did broach the city manager about it at one point, and the mayor independently, logistically, how is this all going to work? I don't know. I'm very confused. But for every day that passes, because I read the daily report of the police department, for every day that passes that we have an uptick in violence is another day that we do not have anything in place for children, families, communities. That was the original set.
So let's do
May I
this.
answer there's a question there, I think, which
Was
I
there
would
a
like to
question?
answer
Okay.
about how will this work. And I think what we mean by placeholder, Alderwoman Pendell-Charles, is simply the money lives in our budget until we determine which department is going to drive the program, and then the money is transferred to their budget. Just to be clear, that won't stay in the mayor's office. It will be transferred once we sort out the logistical management of the program.
What we'll ask, and I'm not doubting the city manager at all, just so that we don't have to ask again, is if we could just get confirmation from the director of Parks and Recs that there's no money in that camp number, and, you know, that involves buses and stuff, that is attributed to Annapolis United. Just a verification. Does Jody know the answer now?
There is no money in the Rec and Parks budget currently for Annapolis
No
United.
scope of work. Oh, okay.
No, it was all put into the mayor's budget.
Okay. The $30,000 for the choice neighborhoods for 2 years, what exactly is that? Is that staff, or is that?
It's staff time, and it's the cost of providing materials and studio services to the Choice Neighbourhood Initiative. We live stream many of the community meetings, so we're providing a raft of logistical support and communication support.
Okay.
Want to consider? Mitchell can help us speak to some of that detail.
I'll see you tomorrow. Okay, take care.
Yeah, there's material support as well. So there's printing and the website and the email and all of that stuff, as well as studio time. We also employ some freelance photographers that photograph and document those meetings.
Okay. City manager, stop me if I can't ask this question. I'm looking at the staffing summary on page 38, and I just wanted to attribute, it says community services specialist. It went from 2 positions to 1 position. What is that?
Griswold's position. Miss Erica Griswold, who's no longer there.
Okay, and who is it now?
Aaron Lee is still there.
I'm sorry, could we put a name to that, or is that appropriate?
I have to say, yeah, thank you. I'm not sure, actually. I would need to check that because we only have 1 community services specialist in the
It
mayor's
says
office.
1 for fiscal year '24.
Yes.
But Alderwoman O'Neill thinks it might have been Erica Griswold last year.
Let me just,
I'm not sure.
Madam Chair.
let me just check.
Oh, there you are, Ms. Connolly.
Yes, if you recall, last year we moved, we established OCS and moved
The office there.
Miss.
Well, that's, I don't want to know who is what. So, go ahead.
But that change was made in '23, I understand, so.
Correct. So it went from. I see what you're saying. Hold, please. Sorry.
Yeah. So I think we might need to check that because
Yeah,
that change was made for the FY '23. There were two in FY '22, and then the community services specialist for Hispanic community activities and programming moved over. So I think that might be incorrect. We'll double check.
Well, the problem is I hear that we have liaisons, and I don't know where they are in the budget.
So the community services specialist is the liaison role. You're quite right, and we may, well, let's try and work to have our language consistent there. But we have liaison. We retain a liaison to the African American community, and the Hispanic liaison community services specialist moved over to OCS with that change last year.
Okay. And then lastly, I know we're over time. If this is, just sorry, I might stump you because looking at the budget as a whole, grants, Ms. Donnelly, on page 29, for example, there's a state grant and there's a county grant under Office of Emergency Management, but it says, I don't know if that's a dash, OIT dash mayor. And there's.
Yes.
You know what that, yeah.
That is the NAM program. So remember, the Naptown anti-dope movement is led from the mayor's office, but is funded through the OIT grant that it is administered by OEM.
Okay.
That's why we'll report further details on that program when OEM presents.
Okay. OIT meaning what again? What is that?
Opioid Intervention Task Force.
Okay. So that's coordinated, and I see that there was no grant, unfortunately, for Naptown anti-dope movement. There wasn't any.
We received grant funding. That program is entirely grant funded. So we received, I think it was close to about $50,000 of funding for the FY23 year.
Sorry, I mean, this might be nickel and diming. I'm not sure. I'm just confused. On page 31, it says OIT Naptown anti-dope movement. Fiscal year 2024, it's zero.
That's because we haven't actually received funding yet. We don't know what that will be. And I think we should ask these questions of OEM because the grant application has gone in, but we don't know what we will be allocated yet. So I'm surprised we haven't penciled in a figure there, but we expect to, we hope to be successful. I know there's always a question mark over how much funding we receive from the county when that grant is administered, and that might be why we've been cautious.
Okay. Can you attend the OEM for a bit? If
I
there's
will,
any
yes, I
questions?
plan to be here,
Okay.
and I'll ask our ANAM team to be here as well.
And my last question is the contractual money for PIO. That's for fits and starts. I mean, she's going to use that money, or is that getting a person continually, or just consulting out when you need it? Just curious on how it's going to work.
We see that as a part-time continual position, working around 15 to 20 hours a week at a rate of around $25 an hour. That makes it commensurate with, say, the contractual assistant ombudsman position. It's that kind of level of position where we're looking for some skill and knowledge, but not an experienced professional, and we're looking for part-time support that's flexible, but yes, ongoing support. And would you mind if we just return to a point that Alderwoman Finlayson raised earlier when she talked about working with other PIOs in the city as backup? I'd like Mitchell to talk a little bit more to that. For example, I know there have been emergencies that are, there have been murders and crimes committed in the city, and the police PIO is actively engaged with APD, but our PIO has had to step in and manage broader communication. And that happens with emergencies. I know it happened with our tornado response. So I'd like Mitchell to talk a little bit more about how that works and why we why we believe we still need this additional support to manage continuity.
Yeah, absolutely.
Hi, Mitchell Stevenson, PIO for the city. What I would envision this job doing would be, as we said, 15 to 20 hours. I would hope for them to manage our social media presence. We have more demands than we've ever had. There are a variety of different portals we use. I'm currently managing 3. I could envision us taking on another one in the next few years. As well, as you all know, proclamations and citations are an ongoing issue. I have stopped vacations. You know, I always bring my laptop with me so that I can take care of those and get those done for folks. But I've also done things, and I'll just give an example. When I was with my family down in Savannah on vacation and Mrs. Cummings was murdered, we didn't have a police PIO at that time. So I spent 2 of my 4 days away working on that press conference with the FBI's communication team. When I was just out in Phoenix for a long weekend with some girlfriends, we had the confirmation hearing for Director Johnson, and there were a bunch of media inquiries, and I was the one who had been coordinating that before I left, so that just fell to me. So I can't think of a vacation that I've had since I started working here 3.5 years ago where I didn't work on vacation, and it would be nice to have somebody that there was backup. Now I do work with the police PIO, particularly in emergency situations when there is, you know, a 24-hour news cycle. But as Alderwoman Pendel Charles knows, during the tornado, they didn't have a PIO. So I was working with the fire department PIO, but they were very much engaged in that door-to-door house, just making sure that everyone in that parole community was okay. That was a 24-hour news cycle that I was on for 3 days. Just making sure we were handling all of the media inquiries. We were getting CNN, we were getting MSNBC, plus all of the local Baltimore, Washington news. It's not a problem. You know, this is the job when you sign up for it, but this would take a little bit of pressure off of me as being the only person that can do it. I'm afraid to take a vacation where I'm out camping and not going to be elections. Yes, the elections was a whole year. I was not really off work. So this would just give us a little bit of backup. And in those emergency situations for police and for fire and for OEM, we do all back each other up. Since we've hired the new police PIO, we now have weekly PIO meetings where we get together with the Rec and Parks marketing person, police, fire, OEM, me. We all check in. What are we doing? Where can we, you know, coordinate efforts? Where can we provide backup support, particularly for events that are going on the weekend, parades, festivals, those type, you know, weekend events, evening events, and that sort of stuff. I'm one person for almost all the other departments in the city besides police, fire, and OEM.
If I could just finish with 3 quick points. As a manager, it's the demand on one of my team is, and the duty of care to the well-being of staff is a big factor in my mind. But more significantly is this continuity, and I think as Mitchell illuminated, it works both ways. You know, sometimes the city PIO might be out and hopefully we can have backup, but sometimes other PIOs are out or unavailable or those positions are unfilled. So there is this gap that is not quite met by working together. And I also wanted to let you know that last year we did try to fulfil the need in the Mayor's office by working more with other PIOs, and we found numerous just logistical barriers to ensuring that we could deliver continuity in the Mayor's office simply by drawing on other resources. So it is with a lot of thought and trying other things that we have finally come and put this proposal on the table for consideration.
If I may, just from an observation, you have 24/7 news cycle, constant. And so if you're not proactive about it, you're reactive, and there could be damage, and that damage could be really bad for the face of the city. It's hard to put a monetary value on that, but we're forced to think of it that way. You have to sort of stay on top of things. and there's a lot of chatter out there, so, and that's just part of the job, but I shouldn't be making my own subjective comments, but that's what I observe. And also, I really appreciate the press releases, because then I in turn send them to my constituents, and constituents love to be informed.
Absolutely. I also just want to say that there has been a little reluctance, I think, both with me and with police and fire, to have somebody from public safety acting as a spokesperson for a mayor, because there is a little bit of a firewall between those public safety officials and what is essentially, a political spokesperson. So I just want to add my 2 cents to that.
Thank you.
Any other? Okay. All right, we did well. Gavel. Right. No, you have to send them in. We're being, sorry, we have to stay strict about this, but you can just
Well, I
email.
would ask that the chair just be consistent with timing in the future. Thank you. That's on you.
Yeah, we sort of got on a digression here on the PIL, so.
Well, I asked you in the interim if we would have an opportunity to discuss. I think it's nice to think that you could get responses in an email that you could have in face-to-face conversation. I think that's part of the reason why those who work full-time jobs try to take off to ask those questions. Keep that in mind.
Right, that's why we're trying to keep this structured, so that.
Well, the structure, okay.
Okay, all right. Can I have a motion?
Motion to adjourn.
And it also says you has legislation on the agenda. Are you addressing that today, or?
I think we'll postpone it till tomorrow, and we'll do it first. Okay, do I have to make a motion on that, or? We're gonna postpone the legislation till tomorrow? Get supplementary appropriation? Okay.
You need a motion on that?
No motion needed?
Are we expecting that the mayor's staff, is there a timeline also on when we email questions?
Sorry, what?
It's just going to say no. Tomorrow first.
I didn't hear her.
Okay, so we're in your motion. What's that?
Is there a timeline? For example, you got your responses in immediately. If I send my questions, I would hope that they would be responded to immediately, correct? Considering the...
Alderman Gates, sounds like it's a very important question, so I'll allow it.
No. I just want to make sure that we are, that it's the expectation is that staff will follow up with consistency, correct?
Yes.
Awesome, thank you.
Yes,
Absolutely.
yes.
And Alderman
don't
Gay-
send
He
them.
Wasn't here this morning.
You weren't here, yes. Follow-up questions can be emailed, but send them to me and or do you want them directly, Kaylin, or do you want them to come from me, so you know what to do with them? Send them to me, and then Kaylin will distribute it to department, and we're asking them to respond within 5 days.
And Alderman
Within
Gay.
5 days?
Alderman
Well, I
Gay.
mean, by the end of the week, or,
Alderman, if I may, Madam Chair, I'm sorry. I will do my best to respond to questions within 24 hours.
Okay. Yeah, I just,
I understand, but I just want to give my personal
Yeah.
commitment to Alderman
Yeah.
Gay and to everyone that I will do my best to respond very quickly.
Yeah, because we'll be on to other departments. Okay. I second. All in favor, signify by saying aye.
Aye.
Aye. Thank you. Sorry.